Franklin County Board of County Commissioners now in session for this regular meeting Tuesday, September 19th. It's good to see you all here. Before we get started this morning, I would like to let you all know that Commissioner Lockley had to go to a doctor's appointment this morning, so he was planning on being here. But doctor's appointments nowadays, you really can't, when you get it, you better take it, because it will be a long time before you get another one. So we will remember him when we pray today, but we're going to go get started. Commissioner Ward, will you lead some prayer and pledge?
Lord, we come to you today as we conduct our county business. We pray that you will guide our thoughts, our minds, our tongues, and our minds to make sure we make the best decisions for our county. We pray that you help Commissioner Lockley in his what he has going on right now at his doctor's appointment today. We pray in your Lord's name. Amen.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for
all. Mr. Morone, before we proceed, I do have something I need to add to the agenda this morning.
Sir?
That I discussed with you before the meeting. I have someone that's been wanting to serve on the Williams board, and they're not on the agenda today, so I want to add that possible action item for the board today
Okay.
to the agenda.
I'll add that to my report, sir.
All right. Anything else we need to discuss before we approve the agenda this morning, Commissioners? All right. Do we have an approval of the agenda?
So move.
All right. We have a motion to approve by Commissioner Ward.
Second.
Second by Commissioner Sanders. Any discussion? All that are in favor? Aye.
Aye.
All that oppose? That is unanimous. Up next, we have approval of minutes and payment of the county bills. The minutes are from the budget hearing from 9/12 and the regular meeting from 8/15.
So move.
A motion to approve by Commissioner Ward. Second by Commissioner Amison. Any discussion? All in favor? Aye. All opposed? That's also unanimous. All right, we are at public comments. I'm just taking them in the order I have them here. Mr. Rudy Ming, please come forward, state your name for the record. You have 3 minutes, sir. I'm sorry, 5 minutes.
Good morning, Commissioners. Rudy Meng, Alligator Point. Beautiful day out there today. Just wanted to thank Cheryl for coming to the APSTA meeting. It was wonderful to see you there. And following up on that, we had talked a bit about boat ramps out at Alligator Point, and had a quick response in regard to an S-curve ramp that showed county ownership of the ramp. I just wanted documentation, some verification of that. The last documentation I have is from a long time ago, and it shows that it was a Mud Cove Inc., a residential neighborhood ownership of the ramp. Anyway, that's it. Thank you. Appreciate it.
Thank you. All right, Mr. Jim Lambert. Okay, he is there. Please come forward, state your name for the record. You have 5 minutes, sir.
Good morning, guys. Jim Lambert, St. George Island. I'm stopping by today to talk to y'all about a situation over on St. George where my road was paved. Ricky, you and I spoke about this on Saturday.
Mm-hmm.
And it's on East Pine Avenue between 5th and 6th Avenue. Now that the road's paved, it's created quite a significant drainage issue on my property. Saturday we had less than a ½ inch of rain, and the runoff from the road actually pushed the water all the way up to my house. So I just need somebody to maybe let me know if that's the way the road was engineered, or if it was constructed properly or improperly to create the drainage issue. And if it was constructed properly, try and get some suggestions from you on what we can do rather quickly before I start having some foundation issues with all the water coming towards the house. If it wasn't constructed properly or per the plans, what steps can be taken by the county to get Dewberry Engineering out of Port St. Joe to come over and correct the situation. So
Anything else, Mr. Lambert?
that's all. Thank you.
Okay. All right, all the other ones are for agenda items. Before we go on, I will say that the issue we're having with the the boat ramp at Alligator Point has been an ongoing deal. In the absence of Commissioner Sanders when she wasn't here, Mr. Morone and I have attended several meetings. We've traveled, went different places, talking with people, the state, different entities about the boat ramps down in Alligator Point and the lack of them, especially with the fact that the state keeps giving them the ability to do aquaculture there in Alligator Harbor when there's no valid place to pull in and pull out. I mean, it's a problem. So, you know, we think we have some ideas on what we could do to help solve that, but the state hasn't agreed with us yet, because it would involve them moving their road like they did at Windmark Beach. Then they could actually use Leonard's Landing. It wouldn't be right at the edge of the road. They own all the property to the north, but that doesn't mean they'll always agree with our estimation. So, and the other thing with the road, Mr. Lambert, I assure you, we have people that we're talking to, they just haven't made it out to look at it yet. But it is not something that's dropped, or that we're unconcerned about.
Did they give you any type of a,
Sir?
any kind of a schedule on that?
Sir, when I get a schedule, I'll give you a schedule, but I was just telling you that not to open a dialogue, but just to answer what you asked during public comments. Just to make everybody aware, usually during public comments, the reason I did it the way I do it, it's your public comment. It's not us to take your time away talking back and forth, so that's why I did it the way I did it. But as soon as we know, you will know, I assure you.
Thank you.
Yes.
Mr. Chairman,
Mhm.
I'm going to defer to Commissioner's comments, and then I'm going to address the issue during Commissioner's comments, but I do plan on talking about it.
Yes, ma'am. Sounds good. Clerk Maxwell, you're up next.
Good morning, Michelle Maxwell, Clerk of Court. I am requesting that the board schedule a special meeting on September the 29th to close out the end of the year to pay all of the county bills. So I just need a good time for you all on September the 29th.
Is that a Friday or what?
Yes, it is.
I'm fine. Don't we usually meet about 10 o'clock in the
Yes,
morning?
I
That's
was gonna
fine.
say, we
Yeah.
meet about 10.
Tim?
Yeah. it
That would
lasts-
give y'all time to do what you need to do during that day.
Yes, yes, we need all the time we can
Yes, ma'am.
get.
And Commissioners, it lasts usually maybe 15 minutes, but it's
Yeah.
a very important accounting feature for the clerk.
The end of the year.
That's
So do we need
right.
to do that by motion and vote?
Yes, please. Yes.
Okay.
So moved.
Second.
We have a motion to approve by Commissioner Sanders, second by Commissioner Ward. Any discussion? All in favor? Aye. All opposed? That's unanimous.
Okay, next up, the clerk's office is authorized by law to pay into the clerk's fine and forfeiture fund all unclaimed money deposited or collected. A list was published in the Apalachicola Times, and pursuant to law, proof of publication is to be filed and recorded in the minutes of the county commission. The list totaled $285 and represented 19 checks that were never cashed. The charge for the advertisement was $16.20, and the proof of publication is attached. And the checks that were not cashed are all jury checks that were wrote out to jurors, and they just have not cashed the checks. So I just need to place this information in the minutes, that's all.
So move.
Second.
We have a motion to approve by Commissioner Ward, second by Commissioner Sanders. Any discussion? All in favor? Aye. All opposed? That's unanimous.
Thank you.
Yes, ma'am, is that it?
That's it.
Well, that was a short report. Thank you, Clerk Maxwell.
Thank you.
Ms. Jennifer Daniels, EOC Director.
Good morning, Commissioners.
Good morning.
I have 3 action items, but I think actually one of my action items is number 5 on the agenda, so that may need to be changed a little bit for me. But my first is I was requesting the board's approval to open the bids for the Emergency Planning, Disaster Recovery, and Mitigation Grant Program Services. And I think that's number 5 on your agenda, shouldn't have been on mine like that. But my second is to request the board's approval and signing of an MOU with FDM, Florida Division of Emergency Management, and WeatherStem. We are trying to get 3 more WeatherStems located in Franklin County. The WeatherStems themselves will not cost us anything, and for 3 years after the WeatherStem stations are installed, WeatherStem even covers all the maintenance and upkeep and pays for everything to do with it. After the 3-year period, then we have to pay a maintenance agreement on the units, which is $2,000 apiece per year. I would like to put these on Alligator Point. I've gotten permission from the fire chief and the fire department at Alligator Point to put one at the firehouse. The second one would go on Dog Island, and it would be, we're looking at somewhere on the airport on the runway to try and get a picture or be able to put a camera on it to see both the Gulf and the Bayside. And the third one would go on St. George Island, and we're working to try and get it put right there somewhere at Lighthouse Park. And the main thing with having these be on those barrier islands and on Alligator Point, and with those 3 new ones and including the ones we already have through the county, we would have such a good picture of actual real-time weather data of what's going on in our county.
Ms. Jenny, are you needing to do each of these by separate motion?
No, I think the MOU covers all 3, Commissioner.
Just one.
Just one, okay.
Just one MOU.
Okay. All right, pleasure of the board.
Mr. Chairman, I'll make a motion to approve.
All right, we have a motion to approve by Commissioner Ward, second by Commissioner Amison. Any discussion? I think it will give us a lot better data, and I'm hoping it works out.
I'm really excited about them being on the outside, so we can actually see pictures of the Gulf and get data on the Gulf side, not just on the bay side.
That's right.
Yes, sir.
Hey, Mr. Chairman,
Okay.
Jennifer, are you gonna have the one still at Island View?
Yes, ma'am. We're
'Cause
not,
the Osprey gets right there, and they like to watch that.
yes, ma'am, it's
Osprey.
really cool.
It
Yes,
is.
ma'am.
It is, because it's flying in, flying out.
Yes, ma'am.
All right. All in favor? Aye. All opposed? That's unanimous.
I have one other before we do the bid, opening of the bids. Requesting the board's approval and signing of a 1-year contract extension for the management experts for contractual services. The management experts work really well with Aaron on a lot of our, HMGP grants, am I right? And on the EOC design grant and quite a few other grants, so,
That's Tracy.
yes.
Sounds like y'all know what you're talking about.
Yes, ma'am.
So move.
All right, we have a
Second.
motion to approve by Commissioner Ward, second by Commissioner Sanders. Any discussion? All in favor? Aye. All opposed? That's unanimous.
Okay, Jen,
Do you
to
want me
open
to?
the bid? Yep.
Yes.
Michael, is there anything on either one of y'all's reports that has anything to do with the EOC? I'm just asking.
Well, since you asked, I'll double check, but, I don't think so.
Okay.
Aaron, anything from your end?
I don't have anything on the, emergency response.
Okay, just want to make sure. That's cool.
Yeah. Oh, no, he's not in a hot seat. We'll open you. You want to explain to them what these are?
These are the bids that we put out the RFP for. This is for actually the contract that we did the emergency contract at the last board meeting that we hired, Jeannie to do. This is the actual contract that we had already put out the RFP, probably a month ago for. It's just closing as of today. We will have our review team that will go through and evaluate all of these bids, and that will be, Aaron will be one, Amanda at my office will be the other, and we're using Jeff he's the director out of Walton County to be our third, to review the bids.
These RFPs, request for proposals?
Yes.
Or number, okay.
Yes.
There you go. So usually what we do, we read out you read out the name of the company, the amount.
There's not gonna be an amount.
Let me know.
No, it's a proposal.
So it's like RFQ.
Yep, yep,
Part.
yep.
These numbers, one, qualification. But anyway, okay, sure, go ahead.
Okay, this is gonna be Canopy Management Consulting Group, and what the full address, or just
No, I just-
where?
Tallahassee,
Florida.
Florida. That's it.
This is Whit O'Brien and sorry, I'm having a Honda.
says no address listed on our sheet.
I don't see one listed in the front here.
You can Google it.
What about on the envelope for the return address?
That's what I was looking for first, but then they didn't even put it on there.
Oh, hand delivered, never mind.
Okay.
Okay.
We don't know who they
Apparently each one was required to give it to you
I
electronically.
wanted an original copy and an electronic copy. This is from Wheeler out of Marianna, Florida. This is from IEM, and that's out of Morrisonville, Nevada.
North Carolina?
Well, they've got a North Carolina mailing address and a Nevada physical address. So, it's Durham, North Carolina, or Morrisonville, Nevada.
You tell me.
She does, actually, she does, yeah, sorry. This one is Summit Group Consulting in Sarasota, Florida. I know that is. The next one is the Integrity Group out of Tallahassee. AC Disaster Consulting out of Sebastian, Florida. Elite Business Strategies out of Tallahassee, Florida. E.L. Robinson Engineering out of Raleigh, North Carolina.
Is that the one that's listed as Hatfield on this sheet?
I'm sorry.
No, you know, on our sheet, it's already pre-filled, but it gives a different name for the Raleigh address. It says Dean Douglas Hatfield.
This says E.L. Robinson.
Okay, E.L. Robinson. I'll change it.
And the tag is in the back.
That's what I was trying to look at.
That's how we open it, so we look
I know.
envelopes.
Yeah, this one says Raleigh, North Carolina. Dean Douglas Hatfield.
That's it, right?
That's the
Okay.
same one.
I'm sorry.
We
Okay.
have a different label on the outside.
Okay, that's fine.
Look at you.
It's all that jujitsu training.
I'm gonna say, yeah. Wanna be Christmas at your house.
Metric Consulting out of Panama City.
You have their electronic.
Is that Panama?
It's an envelope, yes.
Okay.
This says Lake Mary.
Wait a minute.
On here, it says Lake Mary. You said Panama City?
Let me see, hold on.
Well, some of them might be satellite offices or all that, you know.
Yeah, you're right, sir.
That's fine.
You got their multiple offices.
Yes.
And this is Forbes, and they're out of Jacksonville, Florida.
They got it, Springfield, Missouri.
11 of them, huh? That's a good deal. We've had times when we only get one, so.
Looks like,
Jack?
11's great. Yeah, we have times we
looks like
get
they got
zero.
the work cut out for them.
Oh, That's good.
competition.
It does.
And I think that's it.
So now we just need a motion and vote to turn it over to the review committee, which you've already named.
Yes. So moved.
Yes, sir.
We have a motion to approve by Commissioner Amison, second by Commissioner Sanders. Any discussion? All in favor?
Aye.
Any opposed? That's unanimous. Ms. Jennifer, will it be the next meeting when we hear that, or will it be a month from now?
I hope to be next
Okay.
meeting, but with it being so many, it may take a little bit longer.
That's fine.
But yes, I'll keep in
Okay.
touch and let
Yeah,
you know.
just keep us up to date.
Yes, sir.
Thank you, Ms. Jennifer.
Good.
All right. Up next is Mr. Justin Purse. We have a pan care update. Good morning.
Good morning, Commissioners. My name is Justin Purse. I work for PanCare. I'm under the opioid use disorder program called Starting Point. Since our meeting last year, we have installed 10 drug take-back kiosks at 10 locations in the 6 counties we serve, Franklin being one of them. We also have a Ryan White program, which does free testing for HIV and HCV, free screening for anyone who feels that they're at risk. We also have a medically assisted treatment program and a behavioral health program with our mobile unit, which serves all 6 counties that we are serving right now. We do school and after-school prevention programs and participation to educate the children on the dangers of drug use. We also do prison reentry classes, and we also teach classes at the rehab facilities to reach out to the communities. We do a stigma reduction and barriers to care. We also distribute Narcan for anyone who's willing and needs it, or anyone who would like to supply somebody who they think there's a need, mostly family members afflicted by their relatives. We also have had over 100 referrals received, processed, and assisted to date. And then, of course, we have PanCare's medical home and mobile units. And we also participate in community events and public engagement where we hand out Narcan, stigma reduction, barriers to care, meeting with organizations to facilitate the referral process, anywhere from the narcotics unit to the hospitals to the EMTs to churches to rehab facilities to civilians, family members. Since last year and the implementation grant, when we've been doing this, I've seen quite the trend in the right direction as far as we're reaching people, we're helping people. They know we're out there, they're reaching out to us, and we're finding help for people who are suffering with opioid use disorder and substance use disorders. So thank you. It's been a pleasure serving this community, and I look forward to serving for many more years to come.
Thank you, Mr. Purse. I want to ask you a question.
Yes, sir.
Did you say that y'all do currently have one of those collection facilities in Franklin County?
We do, and it's collected over 150 pounds of dangerous or unused medications to date. We don't, per DEA, get to look at what medications it is,
Right.
but we box it up, send it off, they incinerate it. But yes, we do. I believe the location is at the Franklin Gulf Department of Health PanCare office. I think they're linked together.
Right.
I know we have one there, and we might have another one at another location in Franklin. I'm just not exactly sure of it.
Yeah. Yeah, that's a pretty big deal because, well, we have run into, and it's probably not on your radar, but we've run into reports in recent years that they're coming up with DEP, that they're actually finding narcotics and different things in some of the seafood. So stuff that's being dumped, I guess, people are disposing of in the wrong way.
Mhm.
So it's good to know that we do have a disposal facility, you know what I mean?
Yes,
We
and
need to
they're
make sure
being-
people are more aware of that.
And they're being utilized
Yeah.
at a much greater rate than we anticipated. We assumed we would empty them once,
Yeah.
twice a year, and it's turning into once or twice every couple months. So they're moving, and it's good because it empties maybe the people are disposing it in the wrong places, and then also maybe older relatives keep it in their medicine cabinet because they had a surgery and they didn't take the medication, and then their younger relatives are finding it and using
Yeah.
it. So it's a way to dispose of all the
Yeah,
medications
that's right.
in a healthy manner.
Anyone have any questions for Mr. Purse?
If not, not to put you on the spot, but tell me about that, I guess a new pan care location over in Panama City? Is that construction area? where
Yeah, it's under
signed?
construction. They're gonna have a pharmacy, they're gonna have a clinic for pregnancy, I believe, and then they have the OBGYN, and they're gonna have specialists there. This is way outside of my
Okay.
authority or understanding, but I have seen the plans, I've seen what they're doing. They're breaking ground on it.
Yeah.
It's gonna be a fairly large facility that takes up, I believe, at least a city block. It's gonna
it's
be,
Pretty big.
yeah.
It's not gonna replace the vans, though, that you guys have?
Nope.
Okay. just-
Mobile
that-
units will always,
That's where I was really heading, to be honest
Yep.
with you.
Is it in Panama City or Callaway, or, I mean?
Panama.
Panama City, yeah.
Is it all the way in?
Mhm.
And can I
Yep. Go ahead.
speak? I want to thank you for the dental program that you all brought into the county. It really has helped our local folks too. I can remember when Mr. Michael Hill is the one that come and initially brought this plan to Franklin County, and it has been really expanded on, and I want to tell you all I appreciate that.
Oh, yeah, absolutely. It's just great to be involved with the community. Unfortunately, we lost Mr. Hill this year, but his ideas and his plans still go forth, so.
Yep, he's a good man. He's a good man.
Anyone else? Mr. Purse, thank you for the update. We really appreciate it.
Thank you.
All right, up next, Mr. David Walker, Weems CEO, with a presentation.
Are you gonna share from here, David?
Can I? Well, if you have it up there, if you can put it up there, I can.
Yeah, well, I thought, one of the Alex or Dick was gonna share.
Do we need to take a break so you can get that straightened out, sir?
I got a jump drive right here, Michael, if you want to be.
Hold on one second, let's do it this way. I do have it on here already.
He may not need it.
Commissioner, if you guys want to take a stretch, let me get this together, please.
Yeah, let's do that. Let's take 5 minutes.
The forest near the small town of Sumatra, Florida, is shrouded in mystery. The legend of one local family has been told through the ages. It's time for it to be told again, but with a new twist. From local writer and playwright Royce Rolstad comes his book, The Legend of Tate's Hell. On Florida's forgotten coast, a young boy named CB is devastated by nightmares and visions of sinister forces. He must battle his fears in order to protect his family and survive. Evil seems to lurk around every corner, and CB must confront it before it's too late. With death lurking in the shadows, will CB be able to defeat the darkness, or will he succumb to its overwhelming power? Find out in this captivating tale of supernatural suspense, based on a local forgotten coast legend. Get your copy today.
The Panhandle Players invite you to their production of River's Edge, written by local resident Rob Pierce. River's Edge features drama, comedy, and live musical performances, and it will transport you to a place where lives are changed forever by good friends, secrets, and those for whom the end justifies the means. This dessert theater production is being presented September 28th through October 1st. Tickets are limited and are on sale now at panhandleplayers.org. This event is funded in part by the Franklin County TDC.
It's Halloween season. Are you looking for local ghost stories and area legends? Would you like to get hands-on experience with real ghost hunting equipment? If so, do it with Appalach Ghost Tour. Walk the old streets of Apalachicola with your own personal ghostly guide and experience all that and more. Get tickets to this family-friendly tour at AppalachGhostTour.com. You'll have a frightfully good time.
Embrace the pace on Florida's Forgotten Coast.
County Board of County Commissioners are now back in session. Mr. Walker, please proceed.
Good morning, Commissioners. David Walker, CEO, George E. Weems Memorial Hospital. I have with me via Zoom Dick Richard and Alex Zelansky with TRO Jong and Brandon Architectural Firm. They're the one that been the architects on the Weems Memorial Hospital project for a number of years. They helped prepare the document before us this morning. I'd like to follow up and talk about two design options. The first option we had discussed previously, but this have the shell unit that Commissioner Jones was indicated, to have. So this particular unit is a design option unit. It's the existing plan that we have. In the yellow, there is the emergency room department. The blue is the inpatient shell unit, and the green is the diagnostic unit there. And then underneath, you see the different components that would be under that particular unit. The building, the net square footage building will be probably about 17,968 square feet, and the total square feet will be 24,692. So this is the existing plan that we had with the shell unit, and this will be attached to the side of the hospital. And then if you look at the next page is the preliminary budget summary. We want to look at some numbers from the last time I was before the county commission. And these numbers were coordinated by TRO with a construction firm, healthcare construction firm that they work with. And they gave them some preliminary numbers, for construction in our area. The construction costs indicated that it would be $650 per square foot through $750 per square foot. So if you look at the information up on in front of you, on the left side, you have the construction costs for the building would be right around, on the low end, $16 million. And then on the high end, it'll be around $18 million for construction costs. Right below that, we have what we call anticipated soft costs. So anticipated soft costs, that's your equipment, your furnishing, ancillary services, site survey, and et cetera. That number comes to around $2.3 million on the low end and $2.7 million on the high end. And then right below that, you have your owner soft cost contingency that really means if something comes up in a project, if you're building a loan, you have that extra money to put towards the project. So this design one project, the total estimated projected cost will be $19.7 million on the low end, and then on the high end will be $22.7 million for that particular building. The second design option is what we call the freestanding with a connector, a freestanding ED with a connector. And now here's a picture of it. And this will be located in the front of the hospital, there, front of the hospital. And with this design, you have EMS coming to the left side of the building, the drop off in the front part. You have like a circular way. So individuals can either go to the outpatient or go in the ED for services. On the second page here is a little bit more about this particular building. This building is 15,000 square feet, total space used. And then you have your overlay and canopy and connector will bring it to 17,300 square feet. And so the emergency department is located in the red area. You have 6 exam treatment rooms, 2 oversized trauma rooms. You have 1 private sexual assault treatment room, as well as isolation room. And then you also put your lab department and the pharmacies in that particular location as well. The diagnostic suite, which is your imaging suite, you have your x-ray room, CT, ultrasound, and I got a second x-ray there, but you take that out technically, and then you have plans for mammography area options as well. We did on the narrative part put some concept considerations for you as you look at this. You know, some things to think about there. But if you look at the budget piece on this, the projected conceptual budget summary for the freestanding connection building, you're looking at $11.2 million for construction costs for the building itself on the low end, and $12.9 million on the high end. And then your anticipated soft cost comes to 2.1 on the low end and 2.4 on the high end. And then your total estimated project cost is $4.2 million on the low end, and then 16.4 million on the high end. So these are the numbers between the freestanding and the one that would be the shell piece of the hospital. And if you have any questions, I have Dick Richard and Alex. You know, they are here. They've been working with the project for a number of years, and they helped develop this concept.
Mr. Chairman, I've got one question and one comment. Mr. Walker, I really like these plans. What's the CPI, what CPI was used for the estimated construction cost of this? What year? Was it 2023 that he used the most current, or?
Yeah, Dick, I think it could have been the most current. Dick, can you answer that?
Yes, I can. That was a cost figure that we got from a healthcare construction firm, as David mentioned, and it was just in the last 3 weeks. So that's fresh numbers current for today. I would point out the one, I would say, big difference between those two concepts you've just seen is that the second one omits the patient wing. So it just doesn't have the patient beds, it only has the diagnostics and emergency. So that's why the big cost difference.
And just another question.
And the other, if I might interject too, the first one, as David mentioned, is connected around, it kind of wraps around the hospital and ties into the existing hospital in multiple places. And one of the reasons we looked at the sort of more disconnected version is because a lot of times when you tie in to a building that's been around a long time, you're touching a lot of stuff and you can get into some unexpected areas where you've got some complications because of existing conditions. And so we were pulling the building away, trying to avoid a little bit of that potential.
Now, this second, Mr. Chairman, if you will, the second design, obviously cheaper because there's no inpatient beds, but there is a shell, so there is potential for the inpatient beds to be built into the existing shell for the second conceptual plan, correct?
No.
Go ahead, then.
No, go ahead, Dick.
Yeah. I was going to say we're not showing it in the current plan, but it could be added on as far as just the ability to do that. We could tie something in, and the blocks that you're seeing for the emergency and for the diagnostics are consistent between the two concepts. The only difference is that block that's shown for the patient care.
I will say this, Mr. Chairman, this is just a comment. Working and having experience in the hospital and working in an emergency department, I do like the 6 exam room ER with the 2 trauma rooms versus the 4, because obviously 4 exam rooms to me is not sufficient for our community in an emergent situation. But I do like these conceptual designs, and I appreciate you going and getting them for us updated. So thank you.
Thank you.
That's all I have, Chairman.
Anyone else have any questions?
Just one question.
Yes.
Mr. David, has the hospital board seen the conceptual plan?
No, not yet. I sent the email, but we have a meeting next week, and they'll see the conceptual plans. I'll do the presentation next week for
Are
them.
you bringing them to us?
Yes.
So I have a couple of questions, just to make sure what I'm looking at. On both of these, we have listed out construction costs with the low end and the high end. But when you get down underneath it, they're calling it a soft cost, but it's design professional fees. Design fees should be included in the cost of construction, shouldn't they? You can't
Yeah,
construct something without
they
design.
actually are. They're the line above that summary. The contingency or owner soft cost and contingency is really for the unforeseen stuff. And if you've ever built a project, you know there's stuff that you don't always anticipate, and it's the gotchas that come up in the middle of construction, and you hit a pipe that you didn't know was there, or whatever it may be, or somebody wants to add another, room or something. So it's wise to carry a contingency to make sure that you've kind of got your bases covered. And it's not you've got a little pot of money there so that later, if there is a surprise, you got a way to take care of it without, having to go through too many hoops.
Okay, so then on the last line, what would the owner's soft cost contingency of 8% be about?
It's really just that. It's soft costs may be equipment and furnishings that are not in the numbers above, or it may be an unanticipated issue that you run into during construction, or it may be something that you want to add kind of after the fact, that you realize, oh, we should have thought to include this in, but we'd like to have money for a new piece of equipment or whatever it may be. It's a contingency for the unknowns or the things that just may not have been identified initially.
Commissioner,
Okay.
can I just say something?
Yep, you sure can.
Yeah, Dick, I think the commissioner probably was asking about the design professional fees under the soft cost.
Okay.
To explain that. I think that could have been your question, Commissioner.
Well, I'm wondering why design fees aren't included in the construction cost.
Okay.
How are you gonna construct something you haven't designed?
Oh, okay, I see. I understand your question now. Yeah, the construction costs are normally tallied up separately because it's purely foundations, structure, mechanical, electrical, plumbing, and hard elements of the construction. And it's pretty a normal standard in our industry to have that separated from what we call the soft cost, which are maybe a little more pliable, so to speak, that they might be something you could work through and adjust, and that's why we keep those costs separate. Normally, the contractor is responsible for the construction cost, and really all the other costs are non-contractor or owner items, is the way I would describe that.
Okay.
Does that help?
Yes, sir, it does. And again, I was just trying to clarify what I'm looking at. That's all I
Yes.
was asking.
Okay.
One other, not really a question, but an observation. So we are, even the second design, which has some good things, but it has some things that aren't good. I do like Commissioner Ward said, that it has more ER rooms, but it does not have even a potential that I see on the way this site plan is, potential for a shell for patient rooms. I don't see where you would put that at with that current design. But the real observation I want to make is, so these design professional fees we're looking at, even with the design that has more emergency rooms, is greater than the cost of equipment. And that's just an observation. I don't know.
Yeah, and
I know
guess
medical equipment's not cheap, so I don't know how that is. So Mr. Walker, have we purchased new equipment that we're gonna be able to transfer over, or what am I looking at here? Or what are we looking at?
Yep, Dick, you can speak to the professional fees, but the equipment, they just did a 7% estimate, I believe, Dick. Now, we do have some equipment that we will transfer over. For example, we have new radiology equipment that we'll transfer over to the new facility. We have new lab equipment that we'll transfer over to the new facility. We have new ED beds that we'll transfer over because we just got those. Now we probably buy a few more. But I think the design professional fees per the Florida fee schedule is a certain percentage of construction costs. Is that right, Dick?
That's correct. It's just straight up right out of the Florida architectural and engineering fee schedule. So that includes all of the architectural, mechanical, electrical, plumbing, engineering fees, and it's just straight according to the state fee schedule. One note that might be worth making is that with the more fully connected concept, the first one we looked at, that we have advanced those plans a little further than the second scheme. So there would be a bigger credit back on the design and professional fees for what's already been done versus that second scheme. Does that make sense?
It does make sense. I just was, more than anything, I was questioning that percentage was gonna be able to cover our equipment for a new building and to fill out the space and have everything we need.
Yeah, and what
if it does, that's fine, but I don't wanna be in a situation where a year from now, if we do move forward with any of these designs, that we're looking at and saying, well, we need another 500,000 for equipment. We need to know going in that we're covered. That's the only reason I'm asking the question.
Yeah, and I think that's a good point. What we are showing now in the budget are placeholders that are based on our experience as far as the 7% of construction cost. That's it's what we've used historically, but you would be you'd have a much more certain number if we got an equipment consultant involved. They work through with your staff at the hospital to identify every piece of equipment that you're going to put in here and establish a specific budget that could be more reliable. That's what I would recommend as we go forward.
Right. Well, because here's the thing we run into, just because we are a small county, so we kind of get used to it. The base is kind of the same for everybody. So it doesn't matter if we're building a 24,000 square foot facility or 60,000 square foot facility. You have to have a base of a certain amount of equipment for a medical facility. I was just trying to make sure it was all covered. That's all I was asking.
Yeah. And that's a good question, because that's something also what Dick mentioned, we definitely will look at, because we want the best of the best here. And if we can look to, see what other equipment we may need to bring into the ED, see what that cost is, and then look for other opportunities to fund it as well.
Commissioners, anybody else have any questions or concerns?
But thank you, and also, go ahead, Mike. I just want to make a comment. I'll probably be back before the county commission probably in another 2 weeks to a month. There is some capital outlay money, that is for every rural hospital in the state of Florida. And so, we're deciding now, we thought about purchasing a new CT trailer, a new CT machine, or an oxygen, to upgrade an oxygen machine at the hospital, and maybe some hospital doors. So we'll decide, how much money they're gonna give us, and then I'll present it to the hospital board, then I come here, for that approval. But we'll go ahead and probably submit our grant for that, just to let you know.
Okay. Well, and I know, too, Mr. Walker, I know there's been conversations, I personally have conversations with some of our legislatures about it. There's a new, since COVID started, there's a new designation for rural hospitals, the REH designation. Florida hasn't adopted it yet, but I think when I first was looking at it, I thought it was something that we would have to give up one designation to try to get another one.
No.
But I think it can be added to it. But the difference with REH, if the state chooses to adopt it, because it has to be done at the state level before we can even apply for it, and several states have done it, probably 15 across the country have done it through their legislatures, it actually comes with funds that are distributed to the hospital quarterly for each month. So it's not just a designation, it actually has funding that comes with it for rural emergency health.
Yeah, so yeah, that's the Rural Emergency Hospital Program. And the Florida Hospital Association, you know, we'll have 2 priority items for rural hospitals this year. That will be one of them, to get this rule adopted, you know, so hospitals, if they want to go to this designation, you know, they can. And the federal government brought the designation out because a lot of rural hospitals are closing all around the nation.
That's right.
And a lot of them had critical access designation. And so what they did, they tried to make it sweeter for a critical access hospital to receive this designation. They said, if you receive this designation, you have to close your inpatient unit, but we'll give you $3 million a year, you know, to try to make up for that loss there. And so that'll be a priority for the Hospital Association. And the other priority would be the state rural health capital outlay money that we just received. So, but that'll be a high priority. And more than likely, the state will go ahead and adopt that, and then the governor probably will sign it, and probably go into effect probably July 1. The hospitals in the state of Florida would probably do an assessment, especially most of your rural hospitals would do an assessment to see what the benefits of this would be. One of the things that, you know, as we take in consideration, you know, the rural emergency hospital concept is that, if, you know, when you do that, you know, you lose of course, your inpatient beds. You know, there's some questions, you know, will we lose our lip and dish funding, low income pool funding as well? And we get about maybe 1.6 million a year for that, but the federal government is giving you $3 million to make up that cost for that. And what they're trying to do is just try to prevent these rural hospitals from closing. Right. And a lot of hospitals are beginning to adopt that, you know, around the state. Then they have a national group that provide technical assistance, you know, to do an assessment on your hospital. So I'm sure Florida Hospital Association will do an assessment. I'm sure Alliant Management will do an assessment as well. And then, of course, we have this national group, you know, the hospital is interested in it. I did have some conversation with some other hospitals that have went to this model as well in Texas. So it's something that will be on the rising, coming up a lot more in January, but you will hear that term, Rural Emergency Hospital, REH, that designation. So you can do it and still keep your designation here in Franklin County.
Mr. Chairman,
Sorry about that, the long.
No, you're good.
a couple more things. One, there's something I want to discuss with you after the meeting, so I'll be giving you a call.
Okay.
Two, have you or the hospital board ever talked about maybe doing a sustainability audit or study to determine if this is going to be sustainable?
Yeah, okay, yeah, with this, with the building project, yeah, we haven't did it yet, but what happened is that, you know, when you look at trying to get USDA funds, you have to do a financial feasibility study. Okay. And so that feasibility study will have to be completed before you even go to that.
I don't think you're talking about a feasibility. You're
No,
talking about
sustainability, feasibility. Basically saying, if we build this, can we sustain it, I guess?
Yeah.
With what we currently have coming in and coming out.
Okay, yeah, we can look at that, but the feasibility study is like a sustainability study. You know, you have to, you know, we can do a study on this particular, but we'll still have to do another one if the county commission want to move forward to building this or getting into USDA funds to get it. You have to do a financial feasibility study to see technically can you afford a building like this.
So you're saying that USDA would never agree to give us money unless they think that we could actually pay for it?
Yeah, be able to pay for the loan. And there was a financial feasibility study, a sustainability study done from the previous loans, you know, that USDA required the hospital, you know, to do at that particular time. And they look at all your financials from the last 4 or 5 years, you know, they do projections with that as well. And then it was an accounting group that does that, you know, it's an independent group that they call to do that for you.
But At the same time, Mr. Chairman,
No,
if you
go
don't
ahead.
mind, because we got some things we need to talk about this right here. Have you ever done anything that would be, like an analysis of long-term projections of where it's gonna be in, let's say, 5, 10 years?
Yeah, but when you look at the model right now, technically, when you think about healthcare, you got to begin to decide, how would we look 5, 10 years from now? This building project has been going on since 2015, technically. And so, if you don't build anything here totally, you get what you got, you're still gonna have what you have. But there, we hadn't looked at, if we build a new facility right now, it will bring in X amount of dollars. Technically, we have, the same population, the county is growing, the visits is beginning, you might have more visits, people come in for the tourism, things like that. So, doing a replacement facility, that's something that was already planned in a local agreement, I believe. And so, we can go back and say, find a consultant and say, okay, let's do a financial feasibility study, sustainability, say, okay, now, can we build this right now? How would it look? What is the growth projection, technically? We know if you build a new facility, we probably get some new visits, technically. But technically, you're building something to take care of your growing population here in the county.
Well, Mr. Chairman, have you went out there and tried to actively recruit doctors of specialty fields? Have you done that? To get more doctors in?
We haven't,
to
but
provide more services?
No, we haven't.
Provide more money?
Well, we provide more money. We haven't did that. Now, I know Michael Kozar had talked to some GI specialists about, coming into the county.
Have they come?
No, not yet, no.
When have you talked to him, Mr. David?
Well, I hadn't talked.
I'm getting real concerned.
Okay, well, I hadn't talked to him, but Michael Kozar had those conversations with them.
Okay.
Yeah, and now with, I don't want to.
So maybe this might be a conversation we need to have with Mr. Kozar.
He mentioned it during the one-on-one meetings, I
Yeah.
believe.
Another thing, Michael, have we ever heard from Brian Hall on what we requested
No,
him to do?
we talked about, I reached out to him, I have to reach out again to see, what the timeline is for that report that the board asked for, to separate the expense costs of the expense and income of the EMS as a separate department and each clinic individually.
That's it.
So hopefully, he should have something for you, sometime next month, he should have something for you.
Okay, good. Thank you, Michael.
Hmm?
Thank you, Mr.
Now,
Chairman.
any other questions for Mr. Walker? Before we move on to anything else, we do have a couple of people that wish to speak on this action item on the agenda.
Okay.
Potential action item. Ms. Butterfield, you're up first. And I'm just taking them in the order I had them.
Thank you.
No problem.
Michael, could you put page 1 back up?
Give me a second.
Since
ma'am.
that's what I'm referring to specifically. Good morning, David. It's easier to associate if you can see, because it's small print. Can you do that, Michael?
I'm working on it.
Okay. Good morning, Commissioners. My
Morning.
name is Donna Butterfield. I'm here to speak with you concerning today's presentation by Weems Hospital CEO David Walker to rebuild Weems. The last time you were addressed on this issue, it was stated that the construction plans originally submitted to the Agency for Healthcare Administration, Office of Plans and Construction, had been approved through stage 2. That's true. You were also told that since these plans have already been approved, the costs related to moving to the construction phase will be less costly. That is not true. I'm specifically referring, if you can see it, God, I need better glasses. At the very top, it says, underneath the picture, the original concept has been designed and approved through ACA, stage 2. That's correct. Down on concept considerations, timeline. Plans are already ACA stage 2 approved. Design team is further along in documentation and detailing. Agency approval, costs and processes have already been incurred for ACA Stage 2. Those statements are not technically true. I called the ACA Office of Plans and Construction and spoke directly to the employee who has been charged with the Weems plans. He worked on the original, so he knows everything about the up to stage 3, which is get the shovels in the ground. I told him I was an ordinary citizen concerned about health care in Franklin County. This is what I learned. The original Weems plans have been archived since so much time has been elapsed. When I told him that the Board of Commissioners was told that since Weems plans had been approved, no further plan updates would be needed, he actually chuckled and said, no, no, no. The Weems plans were based on building codes from 2017. Since the building codes were revised in 2020, all those plans, Weems plans, will need to be resubmitted with the new codes applied to the construction. I also told the ACA rep that the board was told that ACA would tell Weems exactly what updates are needed, if any. He said absolutely not, that it's not ACA's responsibility. I also asked him if anyone had contacted him on these plans in past 6 months or whatever, and he said, no, I'm the only one who has called his office about the Weems construction plans. By the way, the ACA representative told me another rural hospital is to be built in Blountstown. When the construction bids were received, the cost of construction has doubled from what was previously stated. They're not real sure what they're going to be able to do in Blountstown because of the doubled cost of construction. The gentleman that I spoke with, the way that ACA does it is the state's divided into districts. So this gentleman that I know now has been assigned from the very beginning and will in fact continue to be the mover for any new plans or revised plans. And what he does is he coordinates, goes to electrical, goes to structural, goes to roofing, does to consultants right there in ACA. The Weems has to give them $2,000. They draw from that $2,000 for the costs to evaluate the construction plans. When the $2,000 is used up, basically, kind of like a retainer, then Weems would be billed for the further costs. This is only for your information. It doesn't have necessarily anything to do with my concerns about misstatements. I just heard Mr. Walker say that's not true. When I said, I also asked if anyone had contacted him, the ACA man, he said no one but myself. I want to reemphasize, if you picked up the phone, I've got the phone number, and you say you want to talk to the Weems construction representative, they route you. Nobody else will talk to you because that's the expertise of this one individual. I have no reason to believe that he's not telling me the truth. So,
Let me just make a comment, you know.
anyway,
just say,
frankly, commissioners, I really don't understand how a project of this financial magnitude to the taxpayers of Franklin County can be based on misleading or actually faulty information. I'm not talking about one concept versus the other. I'm talking about true financial disclosure.
Thank you, Ms. Dodd.
Thank you.
Give us just a second, Mr. Walker. Let us finish our public comments. We have another one after her. You will get time to speak, I assure you. Mr. Mason Bean, you're up next.
Morning, Mason Bean, concerned citizens of Franklin County. I'm impressed with all your questions and challenges. We believe that we hope that you will not take action on this today. We feel that all the citizens of Franklin County for better health care deserve a standalone emergency facility somewhere centrally located. Speaking of sustainability, $22 million at a 2.65% government loan for 50 years is $70,000 a month mortgage payment. Thank you.
Mr. Walker?
Yeah, I just want to make a comment, and then Dick Richard can speak about ARCA Stage 2 approval. I spoke with Scott Wash. Scott Wash is the building design director for the Agency for Healthcare Administration. So I didn't speak to his worker. I spoke to him particular, and I also had a staff member in my office when we talked to him about our ARCA Stage 2 application. So I got my information from him. You know, I didn't speak to any worker. I spoke to the building and design director of the Agency for Healthcare Administration, so that was true there. Dick, they've been with the department, worked with our hospital, and they helped us move through ARCA Stage 2 requirement. Now, what Scott Wash told me is that, you know, the building codes would change in January 1st, and that a lot of hospitals have put their, healthcare entities have put their building contracts on hold during the pandemic, you know, and so, and I told them that we were thinking about restarting our building project. You know, can we come back, start at the Stage 2 level, per se. And that's what, I spoke to him, Scott Wash, he's the director of the building and design unit, and I had Craig Gibson in my office when I was on the phone with him, speaking with him. So I just wanted to just make that clarification.
All right.
Thank you.
Anyone else have any questions or concerns, Commissioner? So I do want to make a couple of statements, just to clarify where I see some of these things. And nobody has to agree with me, it's just my take on it. So, as I currently understand, we have instituted this 1 cent tax for healthcare. So, I mean, I understand some of these numbers I really don't like, but it's not getting cheaper. We've looked at these numbers a couple of years ago and they were a couple $1 million less. This is budget neutral to the county. This tax is being collected. It is not coming out of ad valorem. It is not making anybody's property taxes go up. It is budget neutral to the citizens of this county. Because if we do it, it's going to be a bond to be paid for over the time by the tax. And I agree with Mr. Bing in what he said. However, that does not negate the fact that the board that was in place at the time, by a vote of the people, agreed to memorandums with both of the cities to do things that they have yet to do. So, you know, I know that we can't go back. We're here today, we're the board that's currently serving, but we cannot just throw off agreements that we made with the municipalities for the sake of what we think might be better. That should have been handled then, and it was not. So I don't know how we legally get around that if we try to do it. I do understand what's going on. It's very expensive. But we either are gonna start having better health care in Franklin County, or we can continue doing what we're doing. And again, a new facility, whatever it winds up being in Apalachicola, is not the end of health care in Franklin County. It's a good starting point. It has kept us, I've been doing this now for 7 years, for the people, but it has kept us tied to this circle of not being able to really go anywhere with health care really anywhere else in Franklin County, because we keep coming back to what are we gonna do at Williams. We have people that say that it's fine, that they go in there and they get good help. Some people say whatever you do, don't ever go to Williams. You know, it's all over the board. But at some point, we either have to try to step up and make it better, or let's just forget the discussion altogether. I mean, at some point. But this is a general sales tax, so everything that's bought and purchased in Franklin County is going into this hospital tax. Everything. It is budget neutral. It's not gonna cost the citizens any more than they're already paying. It's not on their ad valorem, it's not a special assessment. So I just wanted to make that statement this morning. Anyone have anything else for Mr. Walker? Mr. Walker, thank you for your time.
Thank you.
Mr. Chairman, I'm glad as you move on that the board realized and unfortunately, it seems like the public, some people in the public may not. This was not for you guys to make a decision today. This is information you guys asked for at the previous meeting that's being presented to you now for further review, thought, consideration, and at some point you'll say to me, okay, here's where we want to go next, Michael. You know, we'll go from there.
Yeah.
Mr.
Well,
Chairman.
go ahead.
I was gonna say, to echo what you're saying, I told Michael Rowan a while back, and I won't use the terminology that I use, but we need to do something. It's a circle, circle, circle. It's been going on for 20+ years. People have been paying this tax, and I'm ready to, excuse my language, but get off the pot with it, personally. So, but I wanna make sure that if we do it, it's sustainable, and we can afford it, in other words.
Do we need to do anything special to be able to do Mr. Emick's presentation, or he's gonna be on Zoom?
Well, he's
correct?
there, Ms. Amick.
Okay.
If you would turn on your video, then he'll just pop up on the screen.
All right, well, let's proceed. Mr. Amick, you are up next.
Yeah. There he is.
There he is, he's in the vehicle.
Yep. Robert, you're still muted. If you would just tap on that old microphone. There you go, sir. Good morning, sir.
It's a good morning. I'm always on the go. That's the problem.
It's all good.
All right.
And basically, Robert, what they're asking for is an update as to where we are, the timeline as to when you think the department will be up, some of the training that's being done at the moment, what you've done in the past, and knowing that the fire truck will be delivered early December, late November, depending on the holidays. So with all that in mind, it just kind of wants you to give them an update on that, sir.
Okay. All right. Yeah, we have, and just to kind of maybe go in order on a timeline, we've been doing training. We've been trying to recruit. Recruitment's not going as well as we would like it to, but what we're dealing with what we have and trying to continue, to recruit and retain further as much as possible. Sorry about that. So we have at this moment, we had the recruits over in Ocala. We had to do some training at the fire department and some familiarization with the areas and the fire hydrants and community familiarization as well, and trying to teach the firefighters on how to come together, as one. And it's been a challenge, but we've been doing pretty good on that deal. We've had the firefighters over in Ocala for what we call Volunteer Week. It's an annual deal that happens at the Ocala Fire College, and we have 4 of our people that are certified in hydraulics, which is the study of pumping and understanding how to get the proper amount of water out of the fire truck into the fire hoses and fire flows for what particular fires that they need to do. It's almost a mandatory deal that, you kind of pretty much have to understand the science behind it before you can do it. We have currently 3 certified in fire in the field, forestry, which they're certified to fight brush fires. We have those all got done in Ocala. Most recently out at in another event that gets put on. It's a volunteer week, if you will, out in the Panhandle, and we had 2 of our guys out that way. One of them did get certified in hydraulics. Currently, yesterday we started in-house in town. We had some scheduling issues and we had a little scare. The class was canceled for a little bit, then they put it back on again, but we did start EMR yesterday, which is the emergency medical response. It's what the firefighters are going to need to be first responders, because 80% of their calls are going to be medical and medical assist or any kind of CPR, et cetera. When they come out of that, it's a 40-hour class. They'll be ready to do medical calls at that point. But of course, currently we don't have any vehicles for them viable to drive to do that unless we do a few repairs, which I'll go over next. But we have, once we get out of that class, then they will go through what's called an EVOC class, which is a emergency vehicle driver's training course. And it'll teach them how to maneuver the vehicle, running code 3 and, what to do when they're running lights and sirens and how to park the vehicle and how to maneuver and of course, keep everybody safe and not tear up the new fire trucks. And from that, they've all been encouraged to get into what's called Firefighter 1, which we really need them to be in. We only have one Firefighter 1 course. It's a grow as you go program. It's free from the State Fire College. There is a physical that they have to pass, a medical physical, and we're trying to strive to work towards that and also get some newer recruits that may be better at that than others. But we're hoping to be up and running at some point before the new fire truck hits, which Mike just said was going to be around late November, December. But if we can have everybody pretty much geared up and prepared by the end of October, mid-November, everything will be happy. I'm not sure as to what level of service we're going to be able to provide if we don't have Firefighter 1s in the house more than we have already. But at least they can be running medical calls, medical assists. They can do firefighting from outside the structure if there's a structure fire, and they can do forestry firefighting as well. That's pretty much it with the men in the department. As far as the trucks, we had all the trucks assessed professionally by a company. They came in, did a full assessment, and there's quite a large list to get those trucks back up and running. There's a couple of the trucks that don't need too much, but we need to get moving on that to get repairs made. So we do have at least one backup truck to use, even if we have the new one.
That sounds good to me, Mr. Chairman.
Yes.
Don't mind. That sounds good because Robert, you said you're hoping to have it online or get through with the training by December, around the time we get the truck. So I'm figuring around maybe the first of the year we'd kind of be there.
Yeah.
Yeah.
If I may,
Yeah.
Commissioner Sanderson and Chairman. So Robert, I want to be clear, and I'm sorry, I was under the impression that both of the trucks that are there now was too expensive to repair, but you're saying that there's at least one that we could repair and have it as a backup?
We could, yeah, there's two. The forestry truck needs to get up and running of some sort.
Okay.
Even if it can just move around as a support vehicle.
Okay.
And then one of the other fire trucks, the one that has the ladder, frankly, if the guys aren't going to be certified as a firefighter 1, they're not going to be using the ladder anyhow, and that's the major issue with that truck is the leak. But if that truck can roll and be a backup tanker and pump some water, there's a few things that we could pick and choose some things to use or not use on some of those trucks.
Okay, I'll get more specific information from you.
Yeah, they're not going to be fully functional, but at least something else that can roll besides one truck.
Well, good. I want to start working on that now so that those will be ready hopefully in December, January, like Commissioner Sanders is asking for. Okay, thanks, Robert.
That's what I was saying, Michael, because if he's gonna do that and get that up and running, then we'll have the truck here, we'll have the training done,
Yeah.
and hopefully we'll have more than just one firefighter 1, which is required.
Yes.
And everything, and get on and go with this. And also at the same time, I want everybody to understand that the board has felt that there's a need to keep oversight over the fire department as far as finances and stuff. So we'll keep on with that. And in fact, I think you've got it in your packet for the new fire truck, what the emblems and
The
stuff's
design,
gonna
yes,
be, the
yes.
design.
I'll
So,
put that up there.
with that, and I would hope that this board what they would do is, have, a board chosen to lead them, to do the fire department finances and stuff along with the county, and that board would be answerable to this commission.
Yeah.
Until the time that it's proven that they can be on their own together,
So-
you know.
So you'll start like an advisory board, and then when you feel more comfortable, then you move it into more of like an authority, like over
Yeah.
the fire department.
More of
Yes.
an advisory board.
And there was, Commissioner Sanders, if I may, Robert, there was some confusion among the residents. I think they didn't understand the difference between having to be certified a firefighter 1 versus being a first responder and an EMS training. They thought you were telling them they had to be certified in all those things before the department will be, up and running. But I'm glad we cleared up that we just need as many certified firefighter 1s as possible to have the department up and running. We could debate about the first responders, EMS at a later time. I know it's better. I get you. I see expression, Robert, but, I just want to clarify that.
Yes, well, I mean, technically, on paper, per the state, for us to be fighting fires, interior attack, to be a fire rescue department, there has to be firefighter 1s, period. That used to be kind of left up to the municipality. You do what you wanted, pick and choose, but really it's not. It's a requirement. So, but if our guys are certified in the forestry side, they can fight forest fires, and if they're certified in the EMR, they can provide medical attention. So that's kind of the wing we're going to be rolling under. And if there's a structure fire, we're just going to have a strict adherence that if they're not firefighter 1, they can't make entry.
Robert, to date, how many people have you got that's interested in going and getting the certifications they need now? How many people are you talking about?
Well, honestly, they're all interested, but out of the 11, but only possibly about 3, maybe 4, may be capable of passing physical.
So I want to ask a question. What's the
requirements may supersede the persons that we have.
Mr. Robert, you were mentioning the state requirements. What's the minimum of firefighter 1s that we really should have for this department? Does it say that in state law or no?
Well, there'll have to be 2. There'll have to be 2. There'll have to be 1. And again, department-wide, this is where the gray area starts, how many you want on your truck. But the law is there's a 2 in, 2 out rule. And basically that it requires you to have 4 because before you can make entry, because you get 2 guys inside, 2 guys outside for the obvious possible rescue of the firefighters themselves.
Okay. Well, that's fine. That lets us know where we're trying to get to.
But I think once we get trucks rolling in and out of there, and the guys are assisting with brush fires, and the guys are assisting with some medical calls, and then it may be able to attract some more attention, and we can start bringing in some people who are gung ho and are ready and capable of obtaining their firefighter 1s.
Mr. Chairman, can I ask, Mason, can I put you on the spot for a second? In reference to St. George Island Fire Department as to, you have that look.
Absolutely. I've got John Alonzo here. He's
Yeah,
our
come
assistant
forward,
chief.
please.
Yeah, Commissioner, what I'm trying to get to, and I think Mr. Rudy Meng is in the back. He might be, I'm not sure if he has anything to do with Alligator Point. But my question is here, the comparison of what Robert is talking about, where we're heading with Lanark Village versus some of the other fire departments we have, because they're all volunteer commissioners. So I'd like to hear where they are. Is any of this surprising them?
John Alonzo, St. George Island Volunteer Fire Department Assistant Chief. Michael, thank you very much for bringing that question up. At this point in time at the St. George Island Volunteer Fire Department, we really only have 1 firefighter 1 certified person. There are others that are firefighter 1, but they're actually older than me and less trained. I am the only true firefighter 1 in the St. George Island Volunteer Fire Department, and I'm 62 years old. I did pass the test, but I do have a bad left foot. To my knowledge, Apalachicola Volunteer Fire Department only maybe has 1 or 2 persons also. To my knowledge, and this is just my understanding, not many of the other fire departments in this county are certified to make entry because of the gentleman's correct comment of 4 fully qualified firefighter ones. And besides for being fully qualified, you have to be ready to do it.
Yes.
There are members of the St. George Island Volunteer Fire Department that are firefighter ones, but that's been 10 years maybe, and they are maybe not willing to perform such action. And it's true, you need 4 people, 2 in and 2 out. The 2 out are to rescue the 2 to go in, not to assist anybody else. They're just to rescue the 2 that go in. And thank you very much. If you have any other questions, I'd be happy to answer. Also, I just want to insert one thing. It took me 2 years to get firefighter 1, and I don't have a job. I'm retired, and I did that pretty much full time, and it took me 2 years to qualify firefighter 1. Sir, you can comment on that also. It is not a quick thing. Thank you very much.
Okay. Mr. Robert, how many hours of training does it take usually to get a firefighter 1?
They shifted it around. It started at 160, and I believe we're at 220 right now.
Hello. So that is the reason why I want to mention, and I think this is the appropriate place to mention it. We don't know how it's going to happen, but I want to put it out there since everybody in Franklin County's volunteer fire departments, we might be looking for your help this year at legislative session. The Association of Counties for Rural Counties, we are pushing a legislative agenda that the state needs to add a line item in their budget so that volunteer fire departments can get the training they need without it being cost prohibitive to them volunteering for the people they serve.
Yeah.
So that's one of the things we're gonna push legislatively.
I mean,
So that people are needing to do 200 hours. Not everybody's like Mr. Alonzo that wants to give his time even though he's retired. Some people are younger, they're working jobs, they have to take time off from work to go get this firefighter training, and 200 hours, that takes a while.
I mean, it's
very costly too. You have to hire instructors for sign-offs.
Right.
Very costly.
Right.
One thing it shows you that we're getting to be an older population.
Yes, I was heading there.
Thank you.
Okay. Any more questions or concerns? Thank you all for sharing. I think these are all valid points.
Mr. Chairman, I was gonna bring up too, and I just wanna say thanks to the volunteers, cause it does take a lot, and that
Yes, it does.
firefighter 1 book is about this thick, I saw it, but, nonetheless, I wanna thank our volunteers, because it does take a lot. A lot of people don't realize, I told them, when they showed me that firefighter 1 book, I said, with my other full-time job, I mean, who would want to do that? Who would want to take, but I appreciate them because it takes a special person. And I also want to thank Carabelle for helping St. James Lanark Village out in this time. But in addition to the safety of our citizens, what people also don't realize is this affects insurance rates, homeowners' insurance rates in the area that does not have an active fire department. So if we need to get this not only for the safety of our citizens, but we also need to get it to help those individuals that are getting these letters from the insurance company saying we're dropping you, or your insurance rates are going to go sky high because you don't have an active fire department in the area, and they're trying to protect their interest in what they have with these homes. So it's more than just saving our citizens' lives. That's very important, but it's also, this is a added detail that people don't maybe not realize how important it is.
Commissioner, what it also highlights is at some point, not now, and it might be 3 years from now, it might be 7 years from now. At some point, this board is gonna have to look at working with our volunteer fire departments and trying to at least have some paid staff that are on regular duty and start transitioning where it's not all volunteer based. Not that the volunteers don't do a good job, but for the reasons you've stated, for the property insurance, for the rating, for the different things that the citizens are getting hit with, you know, they deserve to make sure that we can do everything we can, all of our residents deserve that, to help them with any outside cost that could be reduced by actions of this board, is all I'm trying to say.
Well, another fact that come in that I'm gonna wrap my comment is when I was at Alligator Point at the first of the month, I was informed by one of the members of the fire department that I was talking about the mutual aid that Alligator Point had always had with Ocklawaha Bay. Well, when Wakulla County made them paid firefighters They did away with Ocotney Bay. So now, if you call for something, it's coming from Crawfordsville. And so, I mean, we really need to look at this. I think this is a serious issue for the whole county, not just for Lanark, but for the whole county. We need to be very vigilant, and any way we can support whatever we need to do, we need to support it. And I just found out my ISO, because we don't have a fire department over there, is 10. So, you know, and it's gonna be 10 whether I get a fire department or not.
So before we do leave this conversation, we did have somebody that wanted to comment publicly on this agenda item. Mr. Morone, if you could do that this time. Miss Debbie Jordan?
Okay. She's at 1549.
I believe that's right. Let me look, sorry.
All right, Ms. Jordan, you're muted.
Good morning. This is Debbie Jordan. Good morning, everyone. You can hear me?
Yes, ma'am. Go ahead.
Hey, thank you. Thank you, Robert. I'm glad you're here today. I heard some more indication during what your comments about really the need for time certain when we're going to be open, because I know that with the holidays coming up, 1 week can become 2, can become a month. And I'm really hoping that we're not going to end up into February before we have an up and running department, because we really value the volunteers, even when, as you kind of indicated, even when they don't all see it the same way. We need to hold on to these volunteers. And I'd like to know what, if anything, can we do to get them any more training, to keep them interested in wanting to be in the game while we're on this downtime and waiting for this truck to come in, because I just think things can get held up. And also want to ask you, as a member of this community, there are people that want to do things to help, there are people who would be willing to help mow that lawn, probably landscape around it, maybe even paint that building so that it doesn't look like the ISO is 10, as Cheryl said. If we can at least try to show some, get out there and do things like that. We've got people who are willing to do it. Who should they talk to? Should they talk to Michael Morone? Should they talk to you, Robert? Should they talk to Eric?
Well, you can take your pick. Whoever is reachable at the time. I mean, we all have if somebody wants to come help, I mean, that's part of what we were trying to do. We spent some time there with some dumpsters and cleaning the place out at one point, and trying to get the current volunteers to maintain that status is, it's tough to, scheduling. Everybody has their lives, and we're on the infancy. We don't want to put too much pressure on them to.
We don't want to put it up in either. We want to help them.
We already have scheduling issues as it is, trying to get everybody on the same page, which is part of some of the reason why it's taken us this long to get the EMR class out. But it's a work in progress.
Yeah, I think, Robert, Ms. Jordan, I think since it's cooler now, as we all saw this morning when we woke up, and I appreciate that very much, that I think more people will now be willing to come out and help cleaning up and help with painting. But Ms. Jordan, either which way, they can contact myself or Robert. We're always in contact with each other, and we can have, when we get enough people interested, we can set up a date and a weekend where people are available to do it.
That'd be great. There's those huge white timbers by the entries that are falling down and falling apart. I mean, even if I really believe that we can find volunteers that will replace them once we have a go-ahead from somebody to do that. Let us take that pressure off the volunteers. Let them focus on becoming firefighters and getting all their certifications. Let the people help. We want to help. We want a fire department.
Thank you, Ms. Jordan.
I look forward to that. So.
Thank you.
Yes.
All right, let's take unless there is any more questions for Mr. Emmett.
Thank you, Mr. Robert, for coming and explaining what you're doing.
Yeah, we do appreciate the update. We all are looking forward to it being re-upped and kind of going back to business as usual.
Yes, sir. We're doing what we can as quick as we can with what we got. And I apologize for not being at the last meeting. The hurricane kind of took that away from us. We were out there trying to help those folks.
Yeah.
But,
okay.
It's fine. Thank you, Mr. Emmett.
Thank you.
All right, let's take a 5-minute recess and we'll come back to do P and Z. Franklin County Board of County Commissioners now back in session. We are going to our Planning and Zoning Adjustment Board report. Ms. Courtney, please proceed.
All right, good morning.
Good morning.
I just have two things on the planning and zoning agenda to review. The first one is a lot reconfiguration application for 2140 Highway 98 West. These are 3 existing lots that they're just trying to reconfigure to split proportionally so that each one of them has more buildable space. They will be similar in width in order to give more buildable space. At 2140, this was submitted by Mark Wool, who's the applicant. The board did motion for approval for this. Both of these have been reviewed by Mark, and staff is okay with this change.
So they're just basically asking to move some internal lot lines on the.
Yes, that's it.
What they currently have.
Mm-hmm.
Okay.
So basically, excuse me, Mr. Chairman, they're wanting, it looks like on the documentation, it looks like they're turning like, what, 2.5 lots into 3 full lots. I see the split there.
Yeah.
Okay.
This one's a little bit smaller, so they're just trying to kind of proportion it better to have, 3 more buildable lots.
3 even lots.
Mm-hmm.
Ms. Courtney, what size is this entire piece of property?
I think it's over 5 acres.
Okay.
One of them is like 2.71 acres. So they have plenty of space, and they'll meet that minimum.
Okay,
Square
that's
footage.
what I wanted to make sure we were checking the box on. Not that I don't trust what was done by the Planning and Zoning Board, I just was asking the question. All right, any further questions? If not, I'd entertain a motion to either approve or deny.
I'll motion to approve.
Okay, we have a motion to approve by Commissioner Ward.
I'll second with comment.
Go ahead, sir.
You said this was, Courtney, this is Commissioner Ames, and you said this was 5 acres?
I can't remember the exact acreage, but each one has at least an acre they'll meet at least an acre for their minimum for each lot.
The reason I asked is because it's showing 2.71 acres total, and I don't know if that's just like that one. It's kind of unclear what we're looking at here. Or it is to me, and probably not for the other commissioners. Is that, you see what I'm talking
I
about?
do see what you're talking about. How many square feet are in an acre, Ms. Courtney, do you know? I don't either, that's why I asked. Because we do have square footage numbers on here is what I'm getting at.
I see people in the crowd Googling that.
Roughly 42,500. That's not exactly accurate, but generally speaking, that's accurate. Let me consult my advisor Google.
Yeah, but the thing here does say that it's, the total is 2.71 acres in the middle one on the bottom.
2.71 acres.
Is that saying just for that one
I think that's
tract?
just for that one lot.
43,560. Close.
What was that, Attorney Schuler?
43,560 square feet per acre.
Then that can't be right.
Yeah.
Exactly. That has to be just for that one lot.
I wonder why it doesn't have the size of the other 2 lots, that's what concerned me.
Well, that's why it makes it makes it look, Ms. Courtney, I get what Commissioner Amerson is saying. It makes it look like when you're looking at it, and again, we're looking at the one that says proposed lot split. It lists 2.71 acres plus or minus on the middle one, but it doesn't list on any of the other 2, so it makes it look like that one number is good for all of them.
It has to be about each the
Generally
same.
speaking, that's what that means.
So I just want to make sure, the reason I asked the question originally, I want to make sure when they split it, that there's still going to be 1 acre lots.
Okay.
Because there are 1 residential.
And then there'll be, here we go with that. Because it's gotta be an acre minimum, correct?
It's supposed to be that or a lot of record before a certain date.
Yeah, or existing lot of record. And I think these were existing lots. Oh, shoot. I didn't mean to do
Is
that.
there any?
I I think these were existing lots. From what Mark had explained to me, these were existing lots. The 3 of these were existing lots. All they're doing is just moving one of the lines to reconfigure one of the lots.
I understand that. I'm just wanting to make sure that they're all 1 acre lots.
Mr. Mark available
Okay.
for,
I think Michael's.
I want to ask, while Michael's doing, I'll ask you another question, Ms. Courtney. And again, I'm not trying to make it worse, I'm just trying to understand. So we're looking at the application that was at the P and Z. The second page has a picture on it. Go down to the 3rd page, though. No, go up 1. There's 1 in between. Okay, that one. There's a diagram drawn around the southern part of the property. What's that up north refer to?
I think they just own that same piece of property.
Okay, but it's not tied in together?
No. Mm-mm.
Okay. I just wanted to make sure. I was going by what I was seeing.
Do they own the water?
None of them on the water. Yes.
Did you notice?
Well, yes, because.
Yeah, don't go off. This is just the the zoning map.
Yeah,
So-
a lot of them show still, Otis, on the property appraiser
Yeah.
site. It'll show the line going into the water because there used to be property there.
But I'm just wondering if that's comes in the 5 acre.
We need to know that.
Hey,
That-
what you got, what you lose, you snooze.
Oh, that's right.
Well, I understand that, but I'm
Unless
just
you
saying,
build a wall.
the information that Ms. Bankston may be getting may encompass that portion of property that's in the water, and it's reflecting 5 acres, when in
Yeah.
reality, it's only 2 point.
Yeah.
So
you
then
got-
what we're gonna have is an issue of, if we approve this, then they're gonna come back in and say, okay, we want a variance because this isn't an acre.
Exactly.
And then we're gonna have it, yeah.
Yeah, I think we should table it and let staff get more information.
it says 1.38 acres plus or minus above the mean high water line.
So, Commissioners, I walked away to give Mark my iPad so he could look at the same thing you're looking at. He thinks there might be lots of records, so I'm thinking that maybe we might want to table and then let Mark get some more research, and then Courtney could include that. We can include it at the next meeting. It doesn't have to be a P and Z meeting for approval for this.
That is a lot, can I say this? That is a lot that I've been very, very concerned about over there.
What-
And everything, because I don't see it.
So we don't know the total area we're talking about here? Forget the 3 lots. What's the total area? Is it more than 3 acres?
Courtney, if you scrolled up to the property appraisal, I'd looked there myself, Commissioner, so I was looking at to see if I can find that info, but if you see the description,
Yeah, it's very vague.
so
There's
I
no way
would,
that's 5 acres.
Yeah.
I'm just being honest, I mean,
Mr. Chairman, you can't use the property appraiser's website as a reliable, and she even has a disclaimer on her website. I mean, nothing contrary to
Yeah.
PA's office at all, but they have their own disclaimer, and I would also advise you can't use the information on that website. I mean, you need a survey. And I think there's a survey in there that says MB, I'm not sure who that is, but, I mean, I agree, there's too many questions, table it, let Mr. Carrington look at this further and come back and give you some advice.
more information, yes, that's.
I'll amend my motion to table, and thank you for bringing that up, Commissioner Amison.
that's what I'm here for.
Yeah, well, I just want to make sure too, I mean, I know that
looked
that it would be better to have the lot lines maybe the way they want them configured, but there are 3 existing lots of record. And it looks like from looking at them that they currently don't meet the 1 acre minimum, but they're a lot of record, so they can use them as is. So, I mean,
And I was going by, Mr. Chairman, in one of in the middle, it says 2.71 acres.
Yes.
And I was assuming that one piece was 2.71, and then the others were equaling the 5 to make it split evenly. But
If that's over there.
it's you're right, it's very kind of vague,
yeah.
and that's,
Okay, so are we wanting to make a motion to table then?
yeah, I'll amend my motion to
I'll
table.
amend my second.
All right. So we have amended the motion, and now it is a motion to table by Commissioner Ward, second, that has been amended by Commissioner Amison. Any further discussion before we vote? All in favor? Aye. All opposed? That's unanimous. All right, Ms. Courtney?
All right, the second one is 1808 Highway 98 West. This property is zoned R1. They have 2 lots, lots 13 and 14. Now they had a lot more information than the first one, and even a letter from Mark dated back in March of 2022 that basically states that these lots were grandfathered in and that they were created prior to 1978. So all they're doing is reconfiguring the lots to be more evened out, so they have a full lot of 13 and 14. So it'll still be lots 13 and 14, they're just moving the lot line. And both of them will be 80 in width and close to, on this side you've got 99 in length, on this side you've got 111, and this one has 122.55, but both of them will be similar in the 80 in width.
Attorney Schuler, I want to ask you a question. And some advice, really. I know that we have documentation showing these were lots of record. I know that they're not discounting what's been said before we get to this point. However, in our current way it's written up in our land use, for R1, they have to be 1 acre or a lot of record prior to a certain date. Do we have the discretion to allow them to move this lot line? Because to me, they both look the same. They both look the same. One's just got a document from staff saying that they were grandfathered in. That's the only thing I see different between these two applications. I could be wrong. So, but do we have the discretion as a board to be able to reconfigure a lot line on a lot of record that's going to get them where they don't have to worry about the 1 acre minimum?
Mr. Chairman, typically during my time with the county, Alan Pierce and Mark have reviewed and processed these type of planning and zoning reports. I've never before been involved in reviewing them and giving an opinion. If you want me to do so, I'm happy to do whatever new policy the board, directs me to follow. But historically, that's who the board has appointed to review these applications and to make recommendations. But I'll be happy to follow whatever directions y'all want me to look at. If you want me to look at both of these, I'll be happy to do that as well, Mr. Chairman.
Well, Mr. Pierce is no longer here.
I understand. I said during my time.
Some days. No, I'm just kidding.
Well, I'm not trying to put anybody off, but to me, they both look exactly the same, except for one has had county staff saying they're grandfathered in. Am I wrong about what I'm saying?
Wouldn't that be more of a from a legal standpoint we would need to know? Is this whole? That's
what I'm hearing. I mean, traditionally, y'all just have deferred to Alan and Mark. I've really not played much, if any, of a role in these type of things, but I'm more than happy to weigh in and follow whatever new policy the board wants to establish. I mean, I'm fine with that. But I have not personally reviewed either of the applications, nor have I made any recommendation.
Well, I'd make a motion just to table this and let Attorney Schuler take a look at it, make sure from a legal standpoint that we're making an informed and right decision. And then that way we have, we cover ourselves in the same sense.
Commissioner, I'll ask you to add to your motion to have Attorney Schuler confer with Mr. Curran, your planner, as to provide some history and some information.
Oh, absolutely.
That's what I was.
Okay.
That's what I meant.
Yeah.
And I'll add, Commissioners, I'll add these to the next meeting if you're good with that. Okay.
Yes. Yeah, I'm not trying to delay it. I'm just trying to make sure we're looking at it right.
Those are all good points that are being brought up.
Yeah, I get a thing in the pit of my stomach about this.
So we do have a motion to table by Commissioner Anderson. Do we have a second?
I'll second.
All right, we have a second by Commissioner Ward. Any discussion? Okay, under discussion, I will say this just for the record. I'm not opposed to anybody being able to move lot lines on property they already own, as long as we can legally do it. I just want that question to be answered.
See, at this point, I don't even know, are we talking about deeds of record, or are we talking subdivision lots on the plat and I have no idea.
And that's why I was, to reiterate what you said, I'm not against somebody trying to get, if they got property that's conjoined or whatever, and they're trying to break it down evenly, that's fine. But the one thing we gotta really pay attention to is if it's breaking down evenly and we have buildable lots, because all we're gonna do is just have, you know, the citizen up here trying to get a variance, or whoever they may have sold the lot to is gonna be, you know, that, what was your quote there, Commissioner Sanders, about, buyer beware? You know, then we're gonna have that buyer standing there going, well, I bought this and I can't do anything with it, I need to get this and that, and now we're starting to, go down a road I don't particularly feel comfortable with.
Well, and just a comment, if you don't mind, Mr.
Yep,
Chairman.
no, I don't mind.
It scares me, because I'm gonna tell you the reason why. If you hear me every time, just about every meeting we have, I say, not every lot in Franklin County is buildable. You see what I'm saying?
Mhm.
Some of this land has been lost since the 70s and 80s or before. So that's the question. You know, you're gonna, anyway, that's for another time. I've done said what I want to do.
Any more discussion before we vote on this table?
Feels bad.
All in favor?
Aye.
All opposed? That's unanimous. Please proceed, Ms. Courtney.
All right, I just have a couple other things to bring to you before you guys. Staff is currently proposing to try to implement regulations for building height and building setbacks. The building department will be working on the building heights, but as far as setbacks, what I'm proposing is if a dwelling is proposed within so many feet of any of the setbacks, that staff will require like an as-built survey at the cost of the builder, whether that be the contractor or owner. The final number is, you know, up for discussion. Staff was just thinking maybe between 3 and 5 feet. The issue that we've been having is, you know, like before, we've had people who built stairs within the setbacks and say, oops, you know, my bad, and try to get a variance. So if we can pinpoint, we can kind of keep, if we implement something, we can kind of keep that from happening in the future, where they can say, you know, if I build so close to my front, you know, setbacks, they're going to require me to have a survey stating that I'm not going across that setback.
Okay. Is this something you just want us to discuss to possibly?
Yeah.
Okay.
Yes.
Yeah, I'm good with that. I understand what you're saying. So, the other thing that you guys discussed that shows up from the P&Z meeting was about a building height survey. I think that's very, very valid too, because I guarantee you, I don't have to be a betting person to find out. I guarantee you, we've had some homes built that were close to 47 feet that might not be 47, they might be 48, because, you know, they either didn't calculate properly or whatever could be said. But I think some of the steps we can take to make sure that it's handled at the contractor level to the ones that are doing the building, I mean, it is what it is. We have to either be serious about what we have or just not worry about it at all. We cannot continue to be in between.
And Commissioner, I don't think we're going to do this for everyone. It's just those ones that we, you know, may come across us and we say, okay, this one's building a little close to the property line. We need to get a survey afterwards to say, we'll give them the option to say, hey, you know, let's build back a little bit, or the option to say, if you're 3 feet or 5 feet close to that setback, then on your final, we're going to require that as-built survey to show that you're not encroaching into those setbacks.
Yeah, well, there shouldn't be anybody building within 3 or 5 feet without a variance though, right?
Correct, but they do. Some of them try to get a little close to their front property line, which which is fine. But, you know, I don't know if the contractor or builder kind of thinks about, hey, you know, what if my pillars, my guys go out there and the pilings are built, you know, not in the spot where they're supposed to be, not where we, you know, originally put them, and then that may push everything else closer to that front of that property line.
Well, here again goes my other public service announcement. That's why we need some kind of business registration in the county. I believe we could put a stop to some of that. They'd be calculating it properly ahead of time.
I agree.
All right, anything else, Ms. Courtney? Or any
Yes, the
discussion
other
from the board?
thing that I wanted to bring to you guys was, we're still having an issue with Phil. So staff was wanting to know if we could work with the county attorney on getting like an emergency Phil ordinance until a definite Phil ordinance is put into place.
I'm good with that.
May I request that the board allow me to talk to staff about this before you act on any kind of an emergency field ordinance?
Okay.
Mr. Chairman, I was under the impression too, and Courtney, I was gonna get with you about this, a workshop. I know we need to, I see your point, with the ordinance, but, I think we also should have a workshop too while we're working on and thinking about an ordinance.
Sure.
And I think we need to probably schedule one soon, sooner than later, obviously.
Well, if we're gonna have a workshop about field, can I add a little bit extra to that? While we're talking about field, let's talk about clear cutting the lots as well.
Yes, and can we add stormwater drainage as well? It'll be a long
Yes,
workshop, but I
stormwater.
think it's all very
It's all
important
good,
topics.
it's all part together.
Yeah.
Yeah, I just feel like we need to kind of fast track it only because it's, by the time we try to figure out an fill ordinance, it's gonna get worse. And the island is one of the main places that's taken the biggest hit
Yes,
on stormwater as well.
it is,
Mr. Chairman,
yes.
I think we really need to talk about everything. The critical habitat area, because you got a lot of these lots that's being mowed off right to the water.
That's what I'm talking about.
And I mean, you're not having anything there, and you don't have nothing to hold back water at all. And then on the unbuildable lots, we got to know something about that, y'all. It scares me. I'm telling you, it scares me about that. I didn't never think I'd see the time when somebody would want to come in there and get that little piece of land and try to build something on it. I guess.
State owns 90% of our
I know,
property,
I
Commissioner.
know.
There's not much left.
So the concern is, that, I mean, that, it's one after the other, especially on St. George Island, Mr. Chairman, where people now, before they would pull their permit and start to bring in the fill, now they're bringing in the fill before they even come to the office. So that's the concern of your building department. So without, but Attorney Schuler is correct too. I would ask before you do anything, schedule any workshops, anything at all, let him talk to the staff and come back to you and say, okay, commissioners, this is how I think we should proceed. Because again, we started with Phil and you guys had like 4 or 5 things here within like a minute, So yeah, give him a chance to kind of work it through with zoning and with the building department before. That's a really
But I
good
will
idea.
say this, yes, it does need to happen, but if we as a board need to have a special meeting just to set up that workshop, then I'm open to that. So communicate with the ones that have the toughest schedules first, and
I think,
we'll do what we have to.
yeah, I think this is an important issue.
So we need to make that in a motion or just direction to?
I think direction's
I
good for
think
now.
the conversation is fine. And one thing I would point out, in order to honor staff's request that there is an urgency here, perhaps even an emergency, maybe just do the fill ordinance first, and then the board can take more time and deliberate on these other issues. But, what they say, how do you eat an elephant? One bite at a time, so.
But we can do that. I'm just saying, when we start to have the workshop, I want to include that in the workshop. That's what I was trying to say.
Yeah.
I wasn't trying to slow down
The field
doing
problem,
what
yeah.
Ms. Bankston asked.
Sure.
Yeah, let me clarify that. I wasn't trying to slow that down and say, no, we don't need to do that.
And same with me.
We can definitely move forward with that, but when we do have this workshop we're talking about, we need to include all the issues. That's what I was trying to do.
So
I agree.
Good.
Thank you.
if that's the case, I don't schedule public hearings without a motion and vote of the board. So I would need, if y'all are ready for me to prepare some draft of a fill ordinance, for you to consider it a public hearing, and then you can workshop the other issues, then just give me that authority to schedule the public hearing on the fill ordinance only.
Okay.
We're gonna have to have a discussion on the field ordinance. I mean,
Well, we'd do it at the workshop.
okay.
You want to workshop first? Okay.
I thought
Is
you were
that what
saying
you're
you go
saying?
ahead and draft an ordinance and
No,
then.
I was saying if you're ready to move forward and address the fill ordinance now, and then workshop these additional items that the board has identified during the discussion, then I would need authority to schedule a public hearing on a field ordinance public hearing, or if the board wants to and feels it's more appropriate to workshop all of the issues, including the field ordinance, that's fine as well. I just want to make sure that if y'all are ready to move forward, that I have the authority to move forward on a field ordinance.
So-
That's all.
Okay, so what, the way I understood it, Ms. Bankston was asking for us to do an emergency, to get in place some kind of field ordinance,
Correct.
while we're also discussing what an actual ordinance might look like an emergency ordinance.
Well,
That's what I understood her to
they
say.
should be one and the same. They should not really be different. I mean, I wouldn't recommend us, stopping all fill in the county on an emergency basis. I mean, we can get this to, let me look at the calendar. I'm not sure if we can get it to a public hearing in the first meeting in October or not on a fill ordinance.
Okay, while you're looking, I want to ask a question. Ms. Bankston, are we trying to, with this emergency field ordinance, stop all fill in the county? What are we trying to accomplish?
Not really stop it. I was just trying to have a cap, so much yards of fill as a cap off, just to, until we can resolve the whole fill ordinance issue.
So
We
they
just need a
currently
cap.
they currently don't have to have a permit to put fill on property?
They have to have a permit, but we don't have any, it doesn't state how many yards they can bring in. We don't have a cap off. And I feel like we need to kind of cap it off at a certain amount until we can get a fill ordinance in place.
Yeah, okay.
So, Commissioner, I'm with you, Attorney. I recommend you give him the authority today to start working on a public hearing for this fill ordinance. It'll be one and the same. We say emergency, but it's because we need it done as soon as possible.
Yep.
And then, in addition to that, we could start talking about the workshop as a separate item to collectively talk about all these other ideas. But fill is a problem we really need to address as soon as we possibly can.
Well, there are a lot of items that we have historically dealt with in my district that have never, obviously, ever been handled, or we won't be talking about them now.
Yep.
But we need to find some way to turn the spigot off on some of these things.
Sure.
And get going in the right direction.
Mr. Chairman, there is no way possible for me to advertise and conduct a public hearing and give the 10 days required notice before your next meeting on October the 3rd. So we can either schedule it for October the 17th, because the first date of publication that I can get would be Thursday, October the 28th, and I have to have at least 10 days notice before the public hearing. So unless you want me to schedule a special hearing, a special meeting just to consider that ordinance, then I would schedule it for the October 17th hearing, which would be the same day we're going to do the Landmark Village Golf Cart public hearing.
Is everybody good with doing it on the 17th?
I would recommend the 17th, because if you schedule a public hearing, it's just going to be held the week before your regular meeting.
Right. Well, this is gonna be, are you talking about having a public hearing or a workshop, though?
I'm talking about
Public hearing.
Public hearing is what
Okay.
For fill only.
Okay.
just for the field only, and then the board can workshop all these
Oh,
other
okay,
issues
okay.
that you, assuming that's what the board wants to do.
Well, if that's, I want to ask you a question about that, though. So, and I don't know the answer to it, and I usually don't try not to do stuff like this. With the way the state has changed the requirements for us to notify and put stuff out, I know you're talking about a 10-day requirement. We're one of those areas, like a lot of old Florida, where we have a 1-week circulation in the paper. We can't use our digital software we do through Column and notice that publicly starting today and starting at 10-day clock?
No, not the way, we're not set up for that electronic, publication at this point. I know, one of your constitutional officers, I believe it was the tax collector, had, brought up this issue a while back, I guess right after the statute was passed, that allowed for bypassing the newspaper publication and just doing the electronic publication, but, the board has never adopted that, at this point. I mean, it's not that you can't, it's just that you haven't.
Because I know Column's one of the bills we paid today.
Uh-huh.
We're paying them for something.
Well, because we uploaded there, and because the Times has changed the way you send them an ad. I
Right.
believe, Aaron, I know you're not.
No. Column has
They're
nothing to do with
asking
the
about
Times.
how we run ads. and when
Actually,
you upload it.
that is their
Yeah,
portal
it's
for public advertisement.
Right.
Yeah, for the Apalachicola Times, I believe it's due
Friday by 3 o'clock through Column for legal advertisements
Yeah.
for the following week.
Right.
Correct.
Right.
Really, I thought it was noon time, but that was likely better than me.
Well, for Column for the electronic system, it's,
Yeah.
they give you a couple more hours.
Yeah, that's true.
Well, maybe that's something we need to look at adopting, because the state's allowed us to do that. And if it makes us have to wait extra time to be able to handle something, then that's something we should look at. Because we do, I mean, getting back to where I was at, we currently have a contract with Column. It's a software company that allows us to put stuff out digitally. Don't we do that correct?
Yes, again, we use it just specifically for the Times, yes.
Right. Right.
So
For the
not
Times.
the Apalachicola Times, your local
Yeah.
paper.
But Column's digital newspaper application.
Yeah, and Aaron explained, but
Yeah.
basically, Commissioner, whatever we put online on the Apalachicola Times has to go through Columns. That's how they do it now. So but we only use.
Oh, they don't do it themselves anymore?
No.
Oh, okay.
That's what I'm
My
trying to
bad, I
explain.
misunderstood.
Yes, I was trying to
Okay,
explain.
I'll back up.
That's the new procedure
Okay.
for the Apalachicola Times to get
Okay.
ads up there.
Well-
But it's restricted just to the Times, correct?
Yes.
Correct.
Well, I know from talking to them at the FACT conference during the summertime, Column can actually do that for the county. As not sent to the Times, but helping us
Yes.
post our stuff
Okay.
digitally.
Yes.
Because the guy was talking to me about it, and I misunderstood. I knew we were already doing something, but I didn't realize it was for the local
Yes.
paper.
That's
It's all
just-
good. I'm here again now.
No,
Sorry.
we're fine.
All right, so the 17th?
Think we're
What
still
talking
looking for a
about?
motion?
Yeah. We never had a motion yet, did we?
We do not have a motion.
Motion.
So we have a motion to schedule this public hearing on a field ordinance for the 17th of October by Commissioner Ward, second by Commissioner Sanders. Any discussion before we vote?
What time? Gonna do it in the
It's
evening?
gonna be during the regular meeting?
11
Yeah,
o'clock?
yes, sir.
Okay,
That was the policy change the board made at the last meeting.
Yeah.
Otherwise, it would be at 5.
yep. All right, so at 10 o'clock.
I'm sorry.
No, I was just clarifying what you said, 10 o'clock. Any other discussion before we vote? All in favor? Aye. All opposed? That's unanimous.
Thank you, Commissioners.
Thank you.
Mr. Chairman?
Yes.
At the end of her comments, she's got, member Ben Houston has announced his resignation from the Planning and Zoning Commission. This is a letter, and I'm gonna submit it to the board,
Thank you.
putting his resignation in. So I'll be looking for somebody for Planning and Zoning in District 2.
All right. Ms. Griffin, you're up.
Okay, Commissioners, first item, at the August 15th meeting, bids were open for the grant-funded fencing replacement at Vrooman Park. Of the 5 bids received for each bid package, fencing fields 1 and 2, fencing fields 3, and T-ball, Bracewell Fencing's bids were the lowest and all bid documents were in order. The fencing will not be installed until after the completion of the field improvements. Board action to issue the notice of awards and purchase orders to Bracewell for the Vrooman Park fencing projects.
So move.
Motion to approve by Commissioner Ward,
Second.
second by Commissioner Amison. Discussion? All in favor? Aye. All opposed? That's unanimous.
Okay, Commissioners, item number 2, at the September 1st meeting, 1 bid was received for the grant-funded field improvements at Vrooman Park. The bid was released to the county engineers Dewberry and Associates for review and recommendation. Dewberry has checked all of the bid forms and package, and all documents are in order. Board action to issue the notice of award and authorize the chairman to sign contract documents once available with North Florida Construction for the Vrooman Park field improvements.
So move.
Have a motion to approve by Commissioner Ward,
Second.
second by Commissioner Sanders. Any discussion, Commissioners?
Yeah, Mr. Chairman, I just want to make a note. I know that out of all the parks in our county, I don't know which one's the old. I think the newest is Kendrick. I don't know if Vrooman or D.W. Wilson is the oldest, but all I know is this park has been needing
Vrooman.
repairs for so long. And I feel like it's just been neglected. And so I appreciate you going out for grants, Aaron, and getting the grants for this park. And I think the reason why we were able to get the grants is because this park has not had any money funneled into it for so long. And I know with a FERDAP grant, you have to have, was it 10 years? You can't have anything done within the 10 years. It's been years since this park's been upgraded, and it was my passion when I first became elected to get this park upgraded. And, you know, we have what we have to work with. But I'm happy to see this park in addition to all the other parks in the county to get upgraded, because we have so much talent in our community, and these kids, it gives them something to do besides sitting all day at a video game. So I think that this is really good, and I'm very appreciative of the improvements, and I can't wait to see them done. And I'm all about a better Franklin County as a whole with all of our parks, you know. So thank you, Aaron, for that. And thank you, fellow commissioners, for helping me along in the process, and staff.
Yeah, and the lighting project right now, those lights are not active at the moment, and primarily we're just waiting on Duke Energy at this point to be able to connect the lights.
And to let everybody know, it's Vrooman Park, D.W. Wilson Park, and then Kendrick Park.
Okay.
Yeah, D.W. Wilson was built during the time that Commissioner Miscallis was in office, and it was, they had a time with it.
Vrooman's the oldest one though.
Yeah.
Vrooman.
Because it's always been in the same spot. So D.W. Wilson, it used to all be downtown under the bridge in Appalachia, and then moved out and built the big.
Okay.
That's when we wore them knee socks.
There you go, that's knee socks too, buddy.
I'll tell you, I made this comment to Aaron, but, you know, I was, you know, majority of you Major League Baseball players are from the Dominican. I mean, but I was watching them train down there in Dominican Republic, and I got to looking, and I was like, you know what? And this is a shame, with the exception of Kendrick Park. You go and look at DW, and you look at Vrooman, and they have, a third world country has a better looking facility than we do. And I'm not, you know, when I chuckle, it's just a chuckle out of I couldn't believe it when I looked at it. I mean, it's not, and it wouldn't, trust me, it wasn't great, but we could do better. I mean, honestly, we could update a lot of things at some of these older parks. You know, for instance, like a batting cage out there at Donnie Wilson's park, or, you know, you don't even, if it's raining, anybody on this side of the bridge, especially after you guys get your pole barn, I know we have it in Carabel, but, you know, if it's a rainy day or a drizzling day, these kids are shut down on this side, you know. It's just things like that. It's not big, huge projects, but little things like that means a lot whenever, you know, you got kids with nothing to do. Especially in our instance, you know, there's nothing for our youth to do here except sports. And a lot of people in the community that's older and past that stage in life, they kind of, I've heard some grumbling about, well, we do a lot with this, we do a lot of that. What they got to realize is that we don't, our children have nothing to do here. Idle minds is the devil's playground. But I mean, we were just discussing this during break. Look at the youth that we have that's moved forward, that's went on to collegiate levels, and hopefully we'll get that road sign somewhere where we've got a professional somewhere that comes out. But it's important to us, important to me as a father, because I've seen it with my older kids, and plus I've got another one coming along now. But it's our obligation to provide something for them, and I just feel like it just shocked me to look and see that you know, we're just so outdated with those other parks that they need a lot of attention. But that's all the comments I got.
We did have a motion and a second on this, correct?
Yeah, Commissioner Sanders, second.
Yes.
Okay. Any more discussion before we vote? All in favor? Aye. All opposed? That's unanimous.
Okay, Commissioners, item number 3, during the budget workshop, it was discussed that the county road paving projects would be bid differently in the new budget year. It is the county's hope that a paving contract will be issued for a set period based upon specific roads, quantity, or dollar values. This way, in a market experiencing rapid price changes, the county will pay the best rate for the specific scope, and contractors can bid more frequently. This new process will entail blanket engineering services to design and bid the road sections and quantities, and it is time to pursue a formal solicitation process for FEMA recovery projects as well. Board action to approve advertising for qualifications for general engineering services.
Ms. Aaron, before we make a motion on this, I want to ask a question. And because I don't understand. So if we change the way we're bidding it out and we say we have a dollar value, how are we going to know as a county we're getting our best value for XY particular road? Say we put $1 million in there, I'm just throwing a number. $1 million in there. And that road, we could get a bid, it might be 100,000, it might be 120. But if the people who are doing the bidding know that we have $1 million set aside, how do we know we get the best deal for that road?
Well, actually, the dollar value is more for your engineering firm. You know, so
Okay.
you all do have a certain amount of paving funds available for, you know, each district.
right.
So with them, we would likely, you know, task that side would go to the engineering
Okay.
firm. Like, you know, you compile from this
Okay.
list of roads, how much can we reasonably expect to get done?
That's kind of what I thought, but I just thought it better to ask so it could be a public discussion. You know what I mean?
And Mr. Chairman, just to elaborate, and I'm for this, and I'll tell you why, because not to get into too much detail, but I was given a quote to repair a certain road, I'm not gonna tell you where, for an exorbitant amount of money. And I thought we can do better than that. I was using my road paving funds. I mean, I had the money in there, but I'm like, no, that's not the point. It's the principle, the fact that I want to get the best bang for our taxpayer dollars. I'm trying to be a good steward of our taxpayer dollars. So I asked around, and that's why we went out for bids. And I got a $20,000 less amount. So instead of paying, say, $24,000, we got it done for $15,000. And to me, it's, and you say you always get what you pay for, but I went out and looked at it. It was done in a efficient manner, and they did a great job. And so it's all about just making sure we get the best bang for our buck, in my opinion. So I can see where the dollar amount comes into play too.
At least you got a quote, or I'm still waiting
That happens.
on the Hathcock. Still haven't gotten a quote yet. And this would be the second time they measured it.
You get anything paid within the first 8 years that you're in office, you're gonna be doing good.
I'm just asking for a quote.
So we still do have to have a motion. to
I'm
vote
just
on this.
saying.
I'll make a motion.
Yeah, I'm
That's,
just saying all this.
mhm.
I said, I know when I came in here, it was 8 years before we had anything on the paving.
Like I said, I would just like it,
Didn't get a quote.
just to get a quote.
Yeah.
It makes you wonder, do you want to work or not? I mean,
Yeah.
if you don't, just overprice yourself, but at least throw me a number.
I know it, I know it.
So did you make a motion?
Yes, sir.
Commissioner Amison, okay. So we have a motion to approve by Commissioner Amison,
Second.
second by Commissioner Sanders on this general engineering services
Yeah.
request. Do we have any more discussion before we vote? All in favor?
Aye.
All opposed? That's unanimous, 4-0.
Okay, Commissioners, next item number 4. During the budget workshop, it was also discussed that it was time to go through the solicitation process again for county auditing services. Roberson and Associates have served as the county's auditors since 2011-2012. The county last advertised in 2018 when Roberson was renewed, and it's now time to request qualifications from interested firms. Per statutory requirements, there will be a formal public review and ranking done by an audit committee once responses are received. Board action to approve advertising for qualifications for auditing services for the county audit.
So moved.
We have a motion to approve by Commissioner Sanders,
Second.
second by Commissioner Ward. Any discussion, Commissioners? All in favor? Aye. All opposed? It's a 4-0 vote.
Okay, Commissioners, next item number 5, TDC Director John Solomon is unable to attend today due to a scheduling conflict. In his absence, he has asked me to bring up the following request, whereas the St. George Island Lighthouse Keepers Museum can be reimbursed for the replacement of their HVAC system, which failed on August 25th. The museum applied for reimbursement through the Museum Infrastructure Grant Program with the Tourist Development Council on September 8th. Board action to approve the TDC Museum grant reimbursement for the SGI Lighthouse Museum.
So moved.
We have a motion to approve by Commissioner Ward, second by Commissioner Sanders. Discussion?
Yes, Ms.
Go ahead. Go ahead.
Aaron, the TDC Museum grant, in my opinion, was probably one of the best things we could have done. And it all started, I think, with Camp Gordon Johnson to get their parking lot paved. And I think that it has helped tremendously. I know everybody has been able in the county with these museums has been able to tap into these funds to get what needed infrastructure or whatever they needed. I know the Orman House is getting the columns. St. George Island's gotten some money. The Lighthouse in Carabelle's gotten some money. So I really think that this is a really good step in the direction that we need to go to make sure that people can enjoy these museums. So thank you. Thank you, Chairman.
Ms. Griffith, this does check all the boxes that, because normally with the museum grants, just to make sure everybody else is aware, Ms. Griffith is our gatekeeper to make sure it meets all the criteria for it to be able to, that this board set up through the TDC board for those reimbursement grants for museums. It does meet all the criteria?
It does, yep.
Okay.
They are a 501c3. They are also, they were not required to actually obtain 3 quotes because it was not over the $10,000 threshold for the county bid policy, so.
Is there any more discussion before we vote on this motion? All in favor? Aye. Opposed? That's unanimous for it.
Okay, next item is item number 6, board information, property inspections, 248 Highway 98 East Point. Just to give you all a status update on the acquisition of the old Gulf State Bank building, or the possible acquisition. Pillar to Post performed the detailed property inspection, including the mechanical elements such as HVAC and the electrical system. That report has also been sent on to Cates Electric and Gunn Heating for the repair and replacement cost estimates for those items that were noted in the inspection report. Donnie's Pest Control performed the WDO termite inspection. Although no live termites were observed, there was evidence of Formosian termites. I'm probably saying that wrong. The technician mentioned that the building had been treated in some fashion since the last time that he was there years ago, as termite bait stations were located during the inspection, and there was also signs of prior boreholes for treatment, and some repairs had been completed. With that being said, there was still evidence of termite activity, and in order for the county to be able to get a termite bond on the building through them, the building would need to be tinted for Formosan termites. Once a building is tinted, it is guaranteed to be free of termites for a minimum of 10 years. The cost estimate to tint the building is $23,592. The technician also mentioned that Formosan termites have been in Franklin and Gulf counties with greater prevalence since Hurricane Michael. This is likely due to dead and decaying trees damaged in the aftermath of the storm. And also the appraisal reports have not yet been received.
Nor has the survey been received yet.
Okay.
Can I just make a comment, Mr.
Mm-hmm. Go ahead.
I don't want nobody mad at me, but I had to say, I can't be in support of this building being bought by the county with county dollars, not at the tune of $950,000, $1 million, because once you get termites, you got termites. And I would be in favor of a brand new building somewhere for that amount of money, but I will not be supportive of the purchase of this building, not with the condition of the building being what it is. And I hate to go there because not only does it have one type of termite, it had, out of the 4 types of termites that there is, there's 3 types of termites that building's got there. It's been noticed. And the Formosan is the worst one you could have, and that's the one that's been outlined. So, and then I just wanted to make the board aware that I will not be supporting the buying of that building.
Mr. Chairman, so in the past, I guess nobody's ever had termite, because I know, like with my personal home, I have Terminex, and I have a contract with termite protection, and I pay, and they say if termites come, then everything they do is free, and they will pay for the damages.
Yep.
So nobody had the thought of mind to get this protection when, out of all the time, and it might be above your purview, but I was just curious, did that not, I guess nobody did pest inspections or termite control with this building?
Well, the building, was occupied by Gulf State Bank, and then Gulf State Bank actually went through,
FDIC shut them down.
Okay.
Yes.
So,
yeah.
Just like they did Appalachian Coast
Yes,
State Bank.
yes,
You know,
yes. So
all
there,
banks.
yeah, there was,
So
yeah,
I
the
guess
recession was
everybody's-
very hard on a lot of financial institutions. And actually, when the county actually acquired the People's South Bank, was it People's South, or who did we
We
acquire?
bought the other Gulf State Bank building, I thought.
Well, no, that one wasn't Gulf State. I think
No,
that
was
one was a inactive B Bank, or was it the bank?
It was a bank.
A bank.
We have a habit of buying
Yeah.
banks.
Talking
Yeah.
about Citizens Federal, old Citizens
Yeah, that
Federal?
was the one in Carabel, and that one was actually the same way, where it had been
I
a
gotcha.
vacated bank building.
Okay. And another thing too, we're still waiting on appraisals, just so
We are.
everybody, so this
Yeah.
may be even a moot point, depending upon what the appraisals come back at, right? So that's, yeah.
Correct. If the combined average of the 2 appraisals falls outside of the price range, and I think the price range Commissioner Sanders said is correct, then either party, for example, if the appraisals come in above the range, the county can cancel with no cost or obligation. If the average comes in below the range that the seller has set that they will sell, then the seller can cancel without any obligation or risk. That's the way the contract is written.
Well, and that's why it was written up in such a way, like we do with everything else we
Correct.
ever look at. You have time to look at and address these issues, you know, so, or any issues that might come up, so.
Yeah, and we have had one other county building that's been treated in recent history, and that was actually, Fort Coombs Armory was actually tinted for drywood, termites, and subterranean. So we do carry a termite bond on that location as well, since we did the tinting.
Mr. Chairman, Attorney Schuler, so how would these inspections and these issues affect the sales contract? I guess that's my question, basically.
Well, we need to get more information. I think we're waiting on some HVAC estimates because the HVAC is either at or past its lifetime. And also there are electrical issues, that there were apparently some electrical wires. How this happened in a commercial building is beyond me, but they were piggybacking hot wires in the electrical panel. And although I'm a shade tree electrician, even I know not to do that. So I don't know what it's going to cost to, I know Aaron's working with Kate's Electric to get some more estimates on that. So once more information is gathered, and we can come back to the board and say, all right, this cost, this cost, this cost, then the board would be presented with a decision point, regardless really whether the appraisals are back or not, which is, do you want to go back and negotiate or renegotiate potentially with the seller based on, you know, the information from the repair costs that are going to be totaled at some point. I don't know where you are in getting that information. Do we know yet?
I haven't heard back from them yet.
Haven't heard back. Essentially, we have two drop dead dates in the contract. One is at the end of October based on the inspection period. Assuming that the appraisals have not been received by that time, then the board would have to make a decision whether to move forward or not before that late October deadline. That late October inspection period is modified by a further provision in the contract that says once we get the second appraisal, then you have 20 days to make a decision whether to exercise your right under the inspection clause. And just for clarification, not my suggestion, just clarification, what that means under the inspection is if you decide prior to the expiration of that inspection period that you just don't want to move forward, then you can cancel the contract without obligation or risk. Once you go beyond that inspection period, you're locked and must close unless the appraisals come back outside of the range.
And when does that period end?
I believe the date is October the 25th, but I would caveat that by saying I would like to check my calendar. There's lots of things a lot of deadlines that I'm juggling, but I believe it is October 25th. However, let's assume, for example, for whatever reason we got both appraisals in today, then it would be 20 days from today's date, which would be around October the 10th, just for discussion purposes.
Okay.
Now, I will tell you, given the history of how long it takes to get appraisals, I think it's relatively safe to say that the end of October deadline is your most likely deadline. And again, I believe that's October 25th.
Okay.
Okay, well,
Go ahead.
next
Did I
item.
answer your question, Mr.
Yes, sir, thank you.
Next item is item number 7, just some miscellaneous project updates. The new fence has been installed at Island View Park. It does look great. And then we're also working with FDOT and the engineers for placement of the county's emergency warning signs on CR 67 leading up to the construction area for the Wilmette Creek Culvert Repair Project. And that was something that Commissioner Sanders felt very strongly about, and, you know, all in the efforts of public safety. So
That
there will
fence
be
can
some
look
additional signage.
Quick.
Yeah.
That fence, they got that fence done quick.
Yeah.
Looks a lot better.
I will say this, we were at our conference down south, Mr. Chairman, sorry to interrupt. And, you know, we have the FAC, Florida Association of Counties, that's located in Tallahassee. And a lot of those individuals commute to our beautiful county. And one of them even said, "Are you talking about that park?" She brought it up. We were talking about parks and things. And She's like, you remember that part that's on the west, east side of the county, you know, that's going out of town? I said, yes. So you talking about Island View? She's like, yeah. She's like, that fence is ugly. It almost looks like a prison. I'm like, well, we all were in agreement with you on that. And Commissioner of that district, actually, we're getting fenced though, no fence there, so.
We've been talking about it for a long time.
But that just goes to show you, it's not only us in the community that see and know these things, it's also
Yeah.
people that come and visit our area as well, so.
Yeah.
They did it quick though.
They did get it done.
Because it wasn't there the other day, and then all of a sudden.
Boom.
And thank you for fixing the kiosk, Dawn.
Oh, yeah.
I knew that was you,
Yeah.
because I pointed it out too.
Anything else from Ms. Griffin while we're here?
There's only one thing. When is our second public hearing on the budget?
It will be Tuesday at 5:15.
Oh, I didn't
Yep.
put that in here.
Yeah.
I should have done that.
Alan's birthday,
Oh,
26.
that's right. Yep. Yep.
That's Alan's birthday.
That's next Tuesday?
Yes.
Yep.
Yeah.
27.
5:15 right here.
Mr. Rome, before we start your report, let's take a short break.
I'm trying to think, I thought I had some.
Franklin County Board of County Commissioners now back in session. We're going to the report of County Coordinator, Mr. Michael Morone. Please proceed, sir.
All right, Commissioners. Action item 1 on my report. I didn't put pages this time, I'm sorry. At your last meeting, the board approved advertising requests for qualifications or RFPs, either one, for the management or lease of Weems Memorial. That in mind, I reviewed the minutes from as far back as 2005 to help refresh my memory on the events that led up to the current management status of Weems. I'm gonna pause there because at that time I was sitting where Ms. Jessica Gay is sitting, but Attorney Schuler and Commissioner Sanders were knee deep in what happened way back then, where Mike Lake walked in here. I remember it was one of the first meetings I ever did, Jessica. Mike Lake walks in here with the keys and said, "I can't handle your hospital anymore, here you go." And then the week after that was payroll, and you just see Attorney Schuler just bringing back information to the board back again. So anyway, that's where it started. From there, I don't know how we got to Black Hawk, sir. I don't know if you could, I can't remember. I don't remember RFQ. Anyway, from there was Black Hawk, and then after that, at some point, the board allowed the, I'm doing the best I can, allowed the advisory board to become a governing board of the hospital with a lot more authority. And then we started switching out CEOs, blah, 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 and here we are. So, all that said, I also look at some health-related RFPs, RFQs online, and I got some from a couple of places to try and get a sense of how the county should proceed with the future of Weems. All right, Commissioners, based on all that research, my recommendation is the county first advertise for a health care consultant that would assist the board with the process. In that RFQ, what we will be asking this consultant to do is explain the pros and cons of the critical access designation we currently have. Explain the pros and cons of the rural emergency designation that we talked about this morning. Assist the county with the workshops, which I think it should include a workshop designated just for the public to speak on where they think we should be going, to discuss a path forward for Weems Memorial. Create a RFP approved by this board once we agree on the direction of Weems, where we should go, Weems and healthcare for the county overall. Assist the board with the interviews and the selection of the candidate, and make sure that this group, consultant, whatever, have no conflicts, don't have any conflicts with any potential candidate that may show interest in managing or leasing Weems. Talk with staff about this, staff being Aaron and Attorney Schuler, I consider you part of staff, in the best path forward for healthcare in Franklin County. They agree with me. And so we need to have some discussion, and I'm asking the board basically to go with my recommendation, and let's do an RFQ for a firm to assist the county with this process we're about to undertake. Simply put.
Can I ask a question?
Yep.
Did you do it, did the board do an RFQ for when they got Alliant?
No, I do not think so.
Cause that's what I was asking the other day. Did y'all do one back then, because you'd have that to go by?
No, I think that was TMH directed that.
Thank you.
TMH did that?
Yes,
Yep, they sure
I think
did.
so.
They basically said, this is who we like and this is who we back, and we hope you guys will.
Actually, I believe.
Why did we go with TMH's recommendation when TMH doesn't have really
Well,
anything to do with our hospital, do they?
Well, at the time, we thought we had a relationship with TMH to help us with managing the hospital.
Was it just verbal?
And, I don't know if we have anything in
I'm starting to
writing.
let this verbal
don't
stuff.
have anything.
Don't really,
Not with TMH, but
don't really hold
if the
water.
board remembers correctly, it was less about Alliant and more about Jim Coleman, his relationship with Mark O'Brien at TMH. Alliant wasn't first. Jim Coleman worked with another company, left that company, and then he went to Alliant. And the board delayed any selection until his, what the term I'm looking for, you can't, a non-compete clause, was true. There's been a lot. There's been a lot going on here.
So basically, you're wanting to do it this way, Michael, to keep what they call an arm's length for the staff and yourself?
Yes, Commissioner, we're not the ones. I'm sorry, the three of us, we're not the ones.
No.
Well, and no disreflection on nobody. Let's just do an arm's length all the way around. If the RFQ, we're gonna get a consultant, if there's any way that we need to have any kind of medical, legal terms, let's go ahead and add that to it too, because that way Attorney Schuler can kind of like be an arms deal.
Yeah.
You see what I'm saying? And then that way it will be, I think it'll be okay.
Commissioners, let me say this.
I don't think there'll be no
With
legal.
all the research I've done, and the attorney, Mr. Sanders, you correct me if I'm wrong, and again, like you said, no, not throwing shade on anybody, but Commissioner, this is the first time you can proactively decide what is happening with the healthcare in Franklin County. Every other time has been a reactive type of situation.
That's right.
Take advantage of this, commissioners, and let's do it right. That's all I'm saying.
Well, that's the reason why I said what I did. And then that way it won't be, this one wants this and this one wants that. It will be based on what we see in front of us and what's good for the
Mr.
county.
Chairman, I'm in full agreement. I think that we do need to make sure that we have someone, and again, no discredit to any of our staff, but that's knowledgeable in this specific field.
Yep.
To ensure that we have the best of the best, to reach out to people. And we may, by doing this, we may get more interest, in my opinion. Instead of getting 1 or 2 RFQs, we may get 5 or 6, because this person is knowledgeable in what they are doing and how to word the RFQ sufficiently enough to attract the people that might want to come in and give us an RFQ, submit an RFQ. So I'm in total agreement with that. So I guess we need a motion to,
Yes.
okay. I'll make that motion.
I'll second it.
Okay, we have a motion to approve by Commissioner Ward. Sounded like we had 2 seconds by Commissioner Sanders and Commissioner Amison, so we'll record both of those. I do have one question under discussion. Who's gonna be the review committee?
I will tell you, work that out with your consultant,
Okay.
to be very honest with you, sir.
No, I'm talking about the
Well,
review
for the
committee for the consultant we're hiring. Aren't we doing that for RFQs?
Yeah, the 3 of us?
I mean, we had this whole arm length discussion, that's why I'm asking.
I think we can handle the consulting
Okay,
commission,
okay.
I really do.
Well, that's, yeah,
And
that's
Mr.
why I'm
Chairman,
asking.
I'll help out any which way I can, because I do have a background in
Yeah.
healthcare, so I'll help out any which way I can to help facilitate the
But I'm-
process.
I'm sorry I might be overstepping. Does the Board of County Commission want to be the review committee for the consultant?
I don't know anything about that.
Okay.
I mean, I have run a business for several years, but it's not a healthcare business.
And that goes back to what the whole problem, and it's not anything personal or anything, but nobody in this county in here knows anything about the business side. I mean, don't take that wrong, Jessica, but, you know what I mean. I mean, this is out of our league. It's been out of our league for 20-something years. And when I say we, I'm just talking as a whole, as a community. It's time that we get this out and let's start talking to some people that specialize in these fields. That way because inevitably it's our decision, can make the right informed decision for the public, so.
And how I can help is medical language. I know, I may not be a part of the management part of it, but I do kind of know. So I did home health in the past too, so I kind of know how stuff works. So I'll help out any which way I can when it comes to the actual healthcare aspect.
But that being said, I feel more than confident that you 3 can, or 4, could get us the right, get us in the right direction as far as the consultant goes.
Yeah.
I mean, that's not something that's gonna, immediately affect anything as far as the hospital. That's just getting us to the next step, so take your time with that.
I will confirm Attorney Schuler with Aaron. I think depending on how many responses we get to this, maybe we narrow it down and we bring the final 3 for you guys to interview. I don't know. I'll talk to them and see what they think, would be the best way to handle it.
Well, it wasn't, I wasn't asking the question to try to derail anything.
No.
I just want to have that discussion before we get into it.
Yeah, good question.
So we know that we're proactively approaching it and we're trying to, you know what I mean?
Yeah.
That's the only reason I asked.
Yeah, it's critically important as well. It's such
Yeah.
a monumental decision. It's also something that, we need somebody who's specialized
Yeah.
to actually do the review for us, to make a professional recommendation. So
Yeah.
that's.
This is probably the one biggest topic in the whole county.
Yeah. Well,
And I think we need to get it right this time.
Yeah, we do. And I'm glad, Commissioner Sanders, that you brought up, again, not about anybody else, but I'm glad that you brought up about if there is, once we start down this process with the consultant, if there is any discussion about legal, especially going on the conversation we had at our budget hearing about the possibility of getting somebody to either lease or buy the hospital, where it's not a county entity anymore, then we're probably gonna need somebody legal that does mergers and acquisitions of medical facilities.
Yes.
So we know that we're getting the best deal. You know, so.
And that is where, Attorney Schuler would take the lead to help us,
Yes.
Well,
Yes, I'm recruiting you, yes, to basically do some background check for you guys to see which is the best firm, which would he recommend.
Right.
All them attorneys, they all hang out together.
well, I can say this. God has allowed me to serve the people of the county one more time. I have one more opportunity. I have many more opportunity, maybe, to serve the people of Franklin County. But I think it's time that we get our pens out and our shoulders to the desk and we get this situation solved. If we're gonna keep the hospital, let's keep the hospital. If we're gonna build a new hospital, let's build a hospital. If we're gonna bring somebody in to manage it, if we're gonna bring somebody in to lease it, let's do that. But it's gonna be us as the board and the people of Franklin County who make that decision, and let's do it once and for all. We've been very, very, very lucky that we haven't had any major deaths or something like this, but, we're getting, like I said earlier, we're getting to be an older population. Let's handle this problem and to get it done with and taken care of. And then every time we have a meeting, we don't have to be discussing something with the hospital.
And Mr. Chairman, just one more thing, and this is going off on a little bit on a tangent. I know we're going for RFQs, and we know somewhat the future of Weems is, but my thing is this: it's been a county-owned hospital for a long, long time now, and I've always been an advocate. If we're going to be a county-owned hospital, then, in my personal opinion, we need to make a way to make the employees county employees. I'm just throwing that out there because we can't talk behind closed doors, but it's not fair that they're a county-owned hospital and they aren't county employees. I had a call yesterday where somebody was upset because they're changing their insurance, and it's something that we need to look at if we still are gonna stay in the hospital business, which, again, you know my thoughts on that. We need to make sure that they're taken care of too, in addition to all our other county employees, and potentially look at making them county employees. I think in the long run too, because I've been researching insurance, I think it will help our top level, because you can get, and Aaron can maybe help me out with this, if you have X amount of employees, it puts you in another bracket to get cheaper rates. So it might help us in the long run with our other county departments to get cheaper premiums, because that's one of the complaints I've gotten too, is the premiums are too high for our county employees. So it's like, especially if they're putting their children or family on the policy. They're basically working for insurance, and so it might help us in the long run to get more people as county employees to get that cheaper premium rate, if that makes any sense.
It does.
It does make sense.
Mr. Chairman, I'm one of 5, and I can tell you right now that I am adamant about getting the county out of the hospital business, because politics plays no part in medicine.
Yeah.
And it's time that we take that away, because it may be different people, different faces sitting in these seats in the future. And I just, I don't, a doctor or a hospital, for instance, and you have, I'm sure you have experience with this, a county commissioner shouldn't be able to call out that hospital and have an influence on what a medical professional is doing or how they're treating. There's a thing called triage. If somebody calls up because they're upset that they had to wait 15 minutes when they're in the room doing a heart attack and they got a kid out there with the sniffles, that's happened in the past. I mean, we've had that kind of influence. Politics needs to be out of medicine in Franklin County, and that's just where I'm at with it. I mean, plain and simple.
I agree. I've said it many times, the county does not need to be in the hospital business, but here we are.
Exactly. But that's what I'm saying. That's why we're working on another way of getting out of it.
Get out of it, that would be great, but here we are, working on it.
Yeah, it's a work in progress.
Somebody's beeping saying the time's up on that
There you
conversation.
go. That's what that was.
Did y'all hit the gong again?
Any more discussion before we vote? We do have a motion and a second, correct?
Yes.
I think
Yes,
so.
you do.
And did that
Motion, a
include
couple
the-
of seconds.
The legal,
Did you, well, I asked you guys, y'all made the motion to vote. Did you-
Actually, she made the motion and you made the seconds. No, I made the motion and.
we
you all
timed
seconded
the
it.
second.
So,
but that
Did
was.
you
We can just
understand
amend it to include.
what she had
yes,
said?
yes.
So do
Yes.
you want your consultant to recommend the legal, or just go ahead and add legal to this?
Add the legal to it.
Because,
They're
Can
two
we add the
separate.
legal to it?
yeah, and I would prefer the consultant write the RFQ for the legal, if you don't mind.
Oh, okay.
If you don't mind.
Okay.
Okay.
Yeah, I would
Okay.
prefer the
It's
consultant and
fine.
Attorney Schuler write.
Well, we'll just leave it like it is.
Thank
Okay.
you. And then we'll
Is
get
that
that
good?
done once we get the consultant, Commissioner Sanders. That's what
Okay.
we'll do.
We ain't never did this before.
Ooh, tell me
No,
about it.
I think,
This
I
is
think
you for
we're,
all of us.
I think we're moving in the right direction with this.
All right, so,
We're learning.
We just need to
so we'll go how the motion and seconds were made then.
Yes.
Yep.
Okay. Any more discussion? Being we've already been gone, let's vote. All in favor?
Aye.
Any opposed? That's
That
unanimous.
would be a good button to have though. Is it, thumbs up.
Give her any ideas, Commissioner. Item number 2. You worked with Aaron, Commissioner, before. At your last meeting, Mr. Holcomb appeared before you. He discussed the additional consulting services such as the call-out policy, performance-based and evaluation database, and pay, certification, supplemental pay, and the addition of an inmate supervisor 3 position for the road department for your county employees. The board requested a proposal for your services, which I attached. Are we ready to move forward to have that executed so we can start working on some of these projects with Evergreen?
So moved.
Second.
Okay, what are we making a motion for though?
Oh, I'm sorry,
Move
the action to
forward.
approve and authorize your signature on the Evergreen Agreement for additional consulting services.
Okay, but are we, so we're not deciding on which direction we're going?
Actually, we're gonna do them all.
That's what I'm asking.
Oh, I'm
Okay,
sorry.
That's what I'm trying to
Oh,
clarify.
I'm sorry, I didn't clarify that. No, yeah, Commissioner, I'm sorry, the agreement will encompass all. There will be a different structure for certain things, but yes.
Right.
Because the database is one thing, and then he had a separate pricing for it. which
Okay.
is on it. I apologize, yes, sir.
That's fine. So we had a motion by Commissioner Amison, second by Commissioner Ward, is that correct?
I
We have a
think I made
motion
the
and a
motion.
Oh, made the
Yeah.
motion?
Yeah.
Backwards, sorry.
Yeah, backwards. It's all right.
All right. Quick question, though under discussion. Is this in our current budget, or are we doing this out of professional services?
It would be out of professional services.
Okay, that's what I wanted to know. Any more discussion? All in favor? Aye. Any opposed? That's unanimous.
Page over, item number 3, your annual legislative delegation with Representative Schoaf and Senator Simon will be held here on Wednesday, September 27th at 10:30 a.m. Has the board decided on a list of items to discuss with the delegation? That's one thing. And Chairman Jones would like the board to present resolutions of appreciation to the representative and the senator at the start of the delegation for all their hard work and assistance, especially for the legislative appropriations and actions that directly benefited Franklin County during the last legislative session. If approved, the chairman will work with Ms. Courtney Bankson in preparing the resolutions. So 1, board action to approve the resolutions of appreciation for both the representative and the senator. And the second is, how are we gonna go about forming this list to present to them? Are we gonna have just the chairman, or each commissioner will take will take some items? That's a format to think about, but
Mr. Chairman.
but we don't, either which way, we don't meet again before then, so, let's decide. Now, the items on the list, that have to be approved today. I would really like a format as to how we're gonna do it.
Mr. Chairman, I think the first thing we need to do is just go ahead and vote on, since it's board action. So I'm gonna make a motion to approve the resolutions of appreciation to Representative Schoaf and Senator Simon.
Okay. So we have a motion to approve by Commissioner Ward, second by Commissioner Sanders. Any discussion?
Yeah, tell them we'd appreciate some, Triumph money. But, no,
We're working on that.
I'm just making awful jokes.
All in favor? Aye.
Aye.
Any opposed? That's unanimous 4-0.
And then, Mr. Chairman, on the second one, me personally, I think that they're time constrained, and we've got the public that's gonna be involved too. I don't think it's not prudent for every commissioner to get up to speed,
Well,
that's
we
my
do the
opinion.
chairman.
So I agree, we'll just let the chairman
Okay.
speak, but I do wanna bring something up at
If you want to
the,
refer to us, you can.
at the policy conference that the chairman and I attended, last week. One of the things that, and we actually, Franklin County actually brought this up, because in the past, I know I brought it up, but our small county surtax, that's the tax that's going to the hospital. I know if you look at the Department of Revenue's financial handbook for the state of Florida, you look at Franklin County, we have so much unrealized revenue, and I've talked to you and I've talked to Aaron about this. We're capped, because they say you have 1%, but they say you have unrealized revenue, but we're maxed out on that, and I've talked to Attorney Schuler about this too, that 1% we can't get anymore. So even though we have unrealized revenue, there's no way to go about getting it, because that small county surtax basically covers it all up in a nutshell. And the problem is, that's the problem, because we can't get any more because we're maxed. So we have proposed the policy, Franklin County actually come up with this down south, and Chairman spoke about it at our meeting, that we want to, and this is something we need to talk to Schoaf and Simon about, is they need to, up at the legislative level of the state, ensure that they bring this up, because what we want is we want to go the 2%. So we can actually start claiming all these other taxes that we can to help with infrastructure in our county, to help increase funds to our county, to get that, to capture that unrealized, it's millions of dollars of unrealized revenue that we have that we can't get because we're maxed out. If we get another additional percent, then we'll be able to start claiming some of that revenue.
Okay.
And if you want to elaborate.
Yeah, well, the way the statute's currently written up, you have, I think Franklin County has 2.5 or either 3 cents available to it. That would have to be done by a vote of the people through referendum. But since we did the small county surtax and it's a full cent, we're not able to try to do any of the rest of them. Even though there's a 1/2 cent to 1 cent tax that's available to all 67 counties for infrastructure. But since we did the small county surtax, we wouldn't even have the ability to put on the ballot to allow people to vote on the infrastructure tax. So that's all we're doing, is asking them, that's the way it's written up. So we're just asking the legislature to consider amending their language to allow us to take it to a vote of the people. All the counties, not just Franklin, all the counties, but it hits the small counties most. Because most of them use the small county surtax, because you can actually use it for any use. You know what I mean? But if you've enacted, by statute, if you've enacted that small county surtax and it's a full penny, you can't even ask for any of the other ones. It's just kind of wonky the way it's written.
Yep.
Yeah.
And they've got,
Just for my clarification, that small county surtax is our hospital.
Yes.
Yes.
Can I say something too? When we did the healthcare tax, you could do the 1 cent, so that's what we did. They had the 1/2 cent out there, and that's for indigent care.
Right.
But you have to be careful about the indigent care, because when you implement that, not only can the hospital draw from that, but other entities that serve
Franklin County residents.
indigent
Yes.
care in Franklin
Yes.
County.
That's right.
So you got to be careful what you do to make sure that it is serving the people of Franklin County and not others surrounding
I got
the
you.
county.
Well, if it's-
That was a real biggie.
Yeah, but
with
it's
us.
Franklin County residents, how's it not serving Franklin County?
Huh?
If it's Franklin County residents that they're seeing, how's it not serving the county?
because indigent, somebody from Gulf County or Wakulla
that's what
County
I'm
can come.
Yeah, you see what I'm saying?
I
But
do.
Mr. Chairman, there's
In other
also,
words, if you do that, instead of, they can come in here and grab it, and Franklin County will be left out in the cold because it's already grabbed, because they're doing a portion of service to Franklin County residents.
Right.
It's kind of tricky, but it,
Okay.
and just so the public aware, like the chairman did say, this is not gonna be fully our decision. We're not gonna say yes or no. It's the people in the community will be able to
Yeah.
vote as to whether or not they want this. So that, I like that aspect too, because, they should have a say, because it's their tax dollars, but there's also the county public hospital surtax that we could have gone out for. But again, it's all about, we were trying to eliminate any gray areas. I guess I'm just gonna say that.
so y'all are mainly talking about the infrastructure, so.
Well,
Well,
this is,
anything.
the small county
Any other
surtax.
tax that's available right now is not available to us because we're already using the small county surtax.
Okay.
So there's 2.5 cents other that are available that the residents could vote on, but we can't even bring it up because that the way it's written up,
Well, they're gonna have to
we're
change.
using this certain tax, so you're not available to use any of the others.
They're gonna change.
That surtax would be the
Okay,
last
I
one
see.
you'd ever want to go for. That's what you're telling
Pretty
me.
much,
exactly.
pretty much. But
Yeah.
this can help with
Anyway.
stormwater drainage, it can help with roadway, I mean, this tax, the money that comes from this can do parks, it could do all kinds of different things. And I think, again, that's why they went out with this for the hospitals, because it covered the whole gamut and there were no gray areas. But we're limited and there's so much unrealized revenue that we have, again, that we could claim if we had that extra percent.
Yeah, and that is the opportunity cost of basically the 1% that we're levying right now. I mean, that is the opportunity cost, because when you think about the unrestricted uses of that 1%, if we would be able to do road paving, if we could do infrastructure upgrades, I mean, you're talking about, what, $3 million, $2.7 million a year? I mean, it would go a long way. So it's a lot of money that was tied up by that 1%.
Well, and if you knew, so if the residents actually voted for it and you knew you had it, that's gonna continue to come in, you can get a bond and do a bigger project and really make a difference pretty quickly. You know, so. Anyway, just a thought.
So, okay, so as far as the list, I would ask that the board just email me everything so it gives me an opportunity, the chairman and I an opportunity to sit down, kind of formulate that list that you guys send me, and we'll have a presentation ready for the delegation.
That was my list, one of my items.
Okay.
Now, I will say, we were fortunate last year that we actually got some appropriations through the legislature. I don't know that we'll get that amount again this year, but we still need to ask for some stuff. Even though if they're not, multi-millions of dollars, we still need to ask for some stuff.
We need some state property.
That would be nice.
Yes, that too.
Oh,
Let's add that to our list, see if they'll give us some property. I doubt it, but never hurts to ask.
Never hurt to ask, Commissioner.
Well, there's been 2 conversations we've had over the years with them. One's that's been pretty outstanding since Representative Schiff first got elected. And that's trying to get them to give us some property for the potentiality of having more industrial property in Franklin County. But the other thing that recently has come up, if we had some property, we could probably actually make a shooting range and really take care of some of our issues. A gun range, it would really be nice.
And that also being said, Mr. Chairman, in addition to that, I believe it was Mr. Simpson, our attorney, or agricultural commissioner, at a conference that said that was one of his, I think, goals, since he was appointed, was to start allowing some of these smaller rural fiscally constrained counties that was, like us, that had state land, most of the land was state-owned, to try to give some of that land, state-owned land back.
Development rights.
Good deal.
Yeah. Development rights, right?
Yep.
Yeah.
So, Mr. Chairman, I will need a motion. My second motion is just direction as to, our plan is, you guys will submit everything to me, and, Mr. Chairman, you and I will sit down and formulate that list. And I'll circulate it back out to all the commissioners before that date.
Okay.
That works?
Yep.
Okay. I'll move on. Everything else is basically informational. Well, no, can we do the one action item you wanted to amend the meeting for?
Yes.
Commissioners,
Yep.
so the chairman has asked to amend. He would like to appoint Ms. Donna Butterfield from his district to represent his district on the Weems Board of Directors.
I make a motion that we accept Ms. Donna Butterfield on the hospital board.
Second.
We have a motion to approve by Commissioner Sanders, second by Commissioner Amison. Any discussion? Seeing none, all in favor?
Aye.
Any opposed? Thank you.
Okay.
Pass forward. Thank you, Commissioners.
All right.
And thank you, Ms. Donna, for being willing to serve.
I appreciate your confidence. I'll do my best.
Yes, ma'am.
Good luck. Sorry. Item 4, informational. You see that newsletter. If the board is good, I'm going to post it after today about this trail.
Oh, yeah, that's connecting up to the Wallfella Trail.
Exactly.
Yeah, I saw the handout,
what
everything. I'll
people's been
put,
looking
the
for.
same thing I gave you guys, I want to put on the website, but I want to make sure the board was good with it first. Okay.
They sent me a copy too.
Yeah, I
Okay.
got a copy.
Michael, before you go away from this, I wanna just make an announcement about that. Because I think some people, I know I've gotten some emails about that, but I think people are unaware of what really is taking place. So DOT has, through the Sun Trail system, they've got this design. When they finish with this, it's gonna be going all the way to Pensacola. It might not happen in our lifetime, but it's gonna go all the way down, and it's gonna join all over the state. So they're gonna, DOT is gonna do like they always do. They're gonna open times of engagement that people can make comments about it. But that doesn't mean they're gonna change their plan. Because I've had some residents reach out to me, they're like, well, I don't want this close to my house. And I'm like, well, good luck with that, because this is FDOT. So when they do finally start to do it, this is what they're going to do. They're just letting you know, and they're giving you the opportunity to comment on it like they're supposed to do. That doesn't mean they're gonna change their plan because 2 or 3 homeowners don't like it. It is what it is.
That's what I've been.
Yeah,
I just wanna make sure people are aware of that, because,
probably.
yeah, this is in their plan, and they're definitely gonna do it when they get to it.
Commissioner, you hit the nail on the head, because my experience is, and I've been to meetings like with the Boxall Ranch way back at the Armory, you know, they say, well, this is for the public comment, we value your opinion, but the first words out of their mouth is, this is what we're doing.
Exactly.
So, it doesn't matter what you say in that public comment,
They got it
the
down.
decision's made.
Yes.
And it's already been made, but they're just giving you the public comment period.
But with this particular, you know, this is the big sidewalk,
Yep,
basically.
that's right.
And it's gonna come down 319
Mhm.
all the way. You know, I've actually had people calling me wanting to know why we couldn't get that sidewalk like they have in Wacalla in
Mhm.
Franklin
That's
County.
what it
And I
is.
told them, I said, that's the state. I mean, that's not us. So I did, at least I did hit that one right.
Yeah, you did.
But,
Yeah, it's coming.
but I've
It's just
heard
slow.
more people actually excited about having that potentially when they thought it was something the county could do. So, I mean, I don't know if you'll really hear a whole bunch of backlash. I mean, now I'm sure there's gonna be one or two, but.
Well, it moves slow because, I mean, this was first talked about like when I first started serving on the Regional Planning Council on behalf of the county, so 2017, they had mentioned it. And I'm like, really? Okay, we want to, if y'all gonna do it for somebody else, we want it too, that kind of deal. And, but it hasn't happened yet, and that's how long it's been, just in the discussion.
It'll hit that Franklin County line, and it'll pick it back up to
There you
Gulf
go.
County.
There's no telling.
Knowing the state about like the road or their easement cleaning and whatnot, but
Yeah.
I can't help it. I had to take a shot at them, but go ahead.
It's all
yeah.
good.
This has been in the works for a long time in
Yes.
Franklin County. They had it going through to Wacalla, but they couldn't come in Franklin because at that time, the land was privately owned by St. Joe Company.
Now it's not.
And it was out in leases, hunting leases and stuff.
Mhm.
Now it's state-owned, they can do it.
But I got one more little snarky comment with that. But between here and Carabel, we're gonna have a nicer sidewalk than we've got a road.
Well, it's on DOT's
It's-
plan
it's
if they'll quit
happening.
moving it.
Just saying.
It's on their 5-year work plan, but they've moved the
Okay.
date a couple of times in the last couple of
And
years.
you'll be able to walk 45 mile an hour, but you won't be able to drive 45 mile an hour.
No, it's not good.
That is true, it's sad but true.
It is.
And again, like I said before in the past, our timeline is not everybody else's timeline,
No.
unfortunately.
Well, that I'm gonna tell you now, that's been a long timeline. I
Since
mean,
Dennis.
Dennis. I mean, it goes back, I mean, bless the EOC, and I'm not gonna hold us up very long, but when I was at that after actions review, what they call it, a hot wash or whatever, but, I made the comment in there and I felt kind of bad after I did. I said, I got looking around the room and I said, nobody in here, everybody that volunteered, everyone that volunteers are elderly. And I mean, we're talking late 60s up. And one of the ladies I got talking to, she was, majority of them is from the east end of the county, Lanark mostly, in that not Dog Island, but Alligator Point area. And they were commuting all the way over here, and obviously I couldn't help myself. So how long did it take y'all to get over here? 40 minutes to an hour, And a lot of that's because you just can't drive down in between East Point and Carabel very fast at all.
No, you can't.
And now, when I say fast, I mean just the speed limit, really.
Yeah.
But it's a shame.
Rough road.
Takes me 47 minutes.
That's why we're gonna keep having those workshops in the evening.
There you go.
Gonna wear you out.
Now,
Well,
Jessica's done fixed that now. She was worried about Miss Cheryl having to travel.
I gotta tease you a little bit.
Do you have any more information items you want to share, sir?
I don't know anymore.
Yeah,
No,
you
I
do.
do.
Yeah, you do.
The next one is goodwill in Franklin County, Commissioners.
Yep.
Number 5 is really important. There was a statewide commissioner, Ward was involved with this statewide call from Dixie County for inspectors. Commissioner Ward and Steve talked about it. He let me know. He was traveling to Dixie County. He spent the day there doing some inspections. Because of him, some houses got power that same day. I think he got a hat and a challenge coin from them, which, of course, you guys know Steve now. He wants the county to get hats and challenge coins. But we'll discuss that at another budget time.
I agree with Steve.
But I think that was a really good thing for the county, Commissioner.
Mr. Chairman, I'll elaborate. I did get a call, and what happened was, typically in a storm, people lose electricity. Power company just turns it back on. They don't take anything into consideration. Well, what happened was a house caught fire in Suwannee County after the power came back on. So then they decided, and it was a co-op power company, not Duke, that serves us, but they determined that they were needing all houses to be inspected before they even flipped the power back on. So there was 20-plus homes that were still needing power that they would not turn the power to until they were officially inspected. They got asked for the state's help, but they were, you know how it is with the state. So Steve was gracious, and I think he did it on his off day, went down and did it, and was able to help out and get those people power down there and help. So I'm always a big fan of karma and helping each other out, because we may need the favor returned one day.
Yep.
So I was happy and happy that Steve was able to do this, and I thank him for doing that as well.
So that was a good thing, Commissioner.
I bet it was like a ray of sunshine when Steve he brought,
But he is a bubbling ray of sunshine.
Yes, he is.
Item number 6 is just for record keeping. I don't even have to read that one. Item 7, I just want everybody to know that Lombardi's is closed until next week, the 28th. 28th is next week, right? Yeah. And because of staging to finish up the dredge there. That's about it, Commissioners. The dredge company stayed ready to complete dredge, they said, on the 2 Mile Channel. So, yep.
I got one quick, the derelict vessel removal. Could you elaborate on that a little bit? Because I couldn't find the link where you,
Oh, that's the next one, item number 8.
Oh, I thought you was done. I'm sorry.
Oh, no. Item number 8.
Well, move along.
The derelict vessel removal. I sent that list. Actually, they sent it to Mark, as you saw in the email. This is where FWC, they now control. Remember, Commissioner Sanders, there was a time where we were part of that process of helping with selecting the boats or asking to look at boats.
They do it now?
Now they do. They handle everything. The county, we have no say in that anymore.
Well, that's a good thing, because the city of Apalachicola got sued years back because they got a derelict vessel, and the guy sued them, said he was gonna make a houseboat out of a sunk shrimp boat that had been sunk for 10+ years.
Yeah.
And the guy won.
Yeah.
Actually.
Because there was now they have that process to follow where they do a search, so. But yeah, if you want more info, Commissioner Emerson, I'll get Mark to send you a link.
Okay, I didn't see the link, that's why I was asking.
Should be in the email thing. Look.
Should be on that voting improvement.
Yeah, I'm just happy to see that this time, because it's been a couple of years since they've done it, they actually got the 2 derelict vessels that are in Indian Creek. I know, that they've been there for quite a while.
Commissioner Amison, if you go back to the original agenda, Michael's got under his report the links, the blue hyperlinks. You just click on it.
Not the report.
It's like the 3rd one down.
I'm learning. Wow. I got it.
There you go.
I'm so sorry, I thought I put the email as part of
You
the
did.
book. I didn't?
You did, I
Yeah.
just, me.
Just a little education.
There we go.
I'm blonde every once in a while.
Here
No
we go.
offense.
Here we go.
What are you trying to say?
Hey.
Okay,
Wait,
next.
Moving along.
Okay, moving it along. So on the screen in front of you is the new fire truck design. So, why did I put as, anyway, for St. James Lanark Village. This design, Commissioner Sanders had a lot to do with that as to where she wanted the Franklin County to be, where she wanted St. James Lanark Village to be.
And in their patch.
Yes, and so on the door, you can barely see that. Let me see. If I do it, it'll make it any clearer for you.
It's Franklin
See on the door, there's a patch, it's the department's patch, but above that, it says Franklin County. And then on the back of the truck or inside, you see the St. James Lanark Village there. So, that was the,
I just want to make a note, Mr. Chairman. On the patch, there's a guy toting an alligator. I don't know what that's supposed to mean, but.
Getting rid of the gators.
Yeah,
No.
no, I don't think so. No, that's pretty dangerous.
Lanark Village. Lanark Village.
I just saw that. That's pretty funny. That's cute, though.
It's their patch.
It's their patch.
Their patch.
Unless they do
Maybe they're full of
that to the
FSU fans taking that gator.
Here we
Let
go.
that go.
Anyway.
That's number 9, and of course, your next meeting is Tuesday, October 3rd, but the budget public hearing is next Tuesday, 5:15, right here in your meeting room.
Okay.
And as Attorney Schuler loves to tell me, I will go forth and sin no more, at least not get caught.
Just one thing, Mr. Chairman. I just wanted to make a note that tomorrow, Michael, Aaron, and I have a conference call with Bill Klein, the FWC shooting range head, about shooting range possibility. So I'll be bringing back the board a little bit of information, what we gather from that. And in addition to that, I spoke with Caleb Brown. I know in the past I talked about reconfiguring the parking lot at Wayside Park in Carabel, the beach part. And there's just no feasible way. I think we're only gonna make 6 more spaces if we completely change the design of it. And if we had to change it to the way he recommended, there was 2 options. It was gonna take away the parallel parking aspect, and I didn't wanna do that because if an RV or truck with a trailer came in, I didn't want to eliminate them from being able to enjoy the park. So we decided just to keep it the same. I was wanting parking spots on both sides, but there was not enough allowable places to back out without hitting a car that was behind. So the parking lot's just gonna have to stay the same. I just wanted to make the public aware of that.
And actually, Aaron had a good idea when we talked about it a couple months
Yep.
ago. Once you get the new fancy crosswalk, maybe we can find someone across the street that might want to sell some property, and we can make additional parking there,
Yes.
because you'll have a very safe crosswalk to get them back and forth, you know, but one step at a time.
Yep.
One
more thing. I know we talked in the past too about social media when it comes to the board. I know we have to be careful, but in my opinion, I think that it would not be nice if we did have a Facebook page or something to where we could advertise for these positions, because nobody reads the newspaper anymore. Some people still do, but some don't. They go to social media, and a lot of people, let's face it, they don't go to the county website, because when they ask me questions, I said, well, if you go to the county, and they're like blown away by how much the county website is so informative. But if we have that social media aspect, I think we would get a lot more interaction with our community. It provides more transparency. It'll give us an opportunity to, if we have vacancies, we could, like for boards, we can advertise it, or just say, hey, make a post about it, and try to reach out more to the people and get more public input on things like that. That's just a thought. I know we talked about it in the past. I don't know if I think there are a lot of other counties that have it.
Yes,
So,
I agree, because someone called me yesterday about the 2 jobs that's been posted on the website, forgot how long, and was in last week's newspaper. It's like, hey, somebody told me you guys have jobs available. What are they? And I'm like, okay. So, but here's the thing, Commissioner, I agree about the Facebook page. Well, we need somebody to manage it. Right now, it's just Aaron and myself, and I don't even think Attorney Schuler has a Facebook.
You couldn't force me to have
There
it.
we go. So I would say hopefully with one of the new hires, we might be able to squeeze that in as to one of their basic responsibilities. We could start off simple and just do it as a way to, put information out there, and then slowly but surely, we could do more interactive work with it. So if you guys, at some point I'll bring it back to you for a formal motion, but if you guys are good with me at least starting that process after we have our 2 hires, I sure will.
Just turn the comment section off.
Well,
I probably will in the beginning. No,
I
I'll
would
get
do it
aside.
at 11.
I will in the beginning, turn the comment section.
if you don't allow any comments, you can do that. You know what I'm saying? You can't allow
That's what
some and
I'm
not
saying.
allow others.
Right.
Just,
Yeah, it's
best thing to do is turn it off.
Yeah.
So we'll start that way,
Yeah.
and then we'll go from there.
So the only thing I will add to that, Mr. Ron, when we do get to that point, if we think about doing anything like that, whoever's gonna be doing it needs to receive some kind of training.
Public relations
For
training.
public,
Absolutely.
public relations, so.
Yep.
I had
Good
like
point.
3 different Facebook accounts, so I can train them up.
There you go.
Oh, man.
Okay.
Is that it?
Yeah, Commissioner Amison, I'll ask under Commissioner
ahead.
comments. Well, you can do it now.
No,
There
go-
there are two things that I'd like you to address. One is your hard work with Tyndall Air Force Base and our airport. And
You wanted to wait to comment?
either which way.
Thanks for
And
that.
what was the second?
If you want to take action, then
Do
do
it
not
now.
do it under
Oh,
public,
yeah.
or commissioner comment.
It was more for informational. I
It was
believe.
just informational.
God, it was the second thing.
Yeah, you never know
Just
how
like that, it went away.
Was it a dredge?
Wasn't it dredge? It'll come to me. I'm sorry, I'm having a moment, but okay,
He's not blind either.
yeah. That was at you, not at me, so I want to let you know.
Oh,
okay.
yeah, we went there. But, the Tyndall, me and Steve Kirchenbaum went over last week, and, did you call me again?
That was it. Wait, hold
Time
on.
out.
That was Erin. She's
I
in
think
charge of the
somebody
guard.
Handle something.
Wow, it's really not that important.
She's practicing her jujitsu at work. She's trying to do her little.
But we went over and, with intentions last week to, speak, to try to get in with I'm Army, so I get all this confused with the Air Force, but yeah, the Colonel, he's the base commander, yeah, the base commander. Well, anyway, we went over last week, they took us on a PR tour, and to be honest with you, the guy was great, showed us all, and they're the whole rebuild of the Army and the billions of dollars that the federal government's spending rebuilding that, Air Force Base, and, I said Army. But anyway, long story short, he basically told us in a nice way that you're probably not gonna see the commander, and yada, yada. But before it was over with, we were heading back, and we get a phone call, said, hey, the commander wants to meet with you, and be there, can you be there Monday morning, bright and early. So we went over, yesterday morning, and had a, sit down with the commander, their legal staff, and, the assistant commander, and had a conversation, and basically, what it boiled down to is I just straight up told him, because they're hesitant to, give us any kind of, I just told him, I said, look, I'm not after you committing anything, but what we would like to know is would you be interested in writing us a letter of support, saying that Tyndall would, what's the instrumental, I might have to get Ted up here with that one, but, the IRS.
Hey, Ted, what's it, the IR something for the airport?
ILS,
The landing with
IRS,
instruments?
it's the instrumental landing
Yeah.
systems, what the ILS. But anyway, long story short, he said, before it was over with, he said, we could do that. We could write you a letter of support over intent that if you get the ILS system in, get the extension potentially down the road, to help us open us up for funding with Triumph. Our intent is if we can get these letters of support, it would sway Triumph more so to help us out and maybe get it run on up the ladder a little more. So we're just trying to get you some ammunition when you have these discussions, especially with Senator Simon and so forth. But it went good. He said, yeah, we'll get that out to you. We actually looked for your email because we told him to send it to the chairman of the county commission. But it was a good conversation. And me, especially with it being in my district, I was kind of hesitant because, well, I really wasn't hesitant, but I was kind of on edge because I didn't really know what interest the military, and especially with my military experience, you don't know what they want to do. So we had that conversation. Well, really, he kind of took the conversation and ran with it. And, it's not a full scale, it's not no, the military's coming to Apalachicola or anything, but what interested me in it is their only peak interest in that airport would be for an emergency touchdown. So in other words, if they have aircraft that's out and let's say an F-35 can't get back in to Tyndall because of a hailstorm, it's beneficial to them to have satellite runways where they can set them down, potentially refuel them if they have to, and then get them back in the air once it passes. That was their really only interest in having it, but it's a solid interest. So just wanted to let y'all know we've had that conversation, they're very interested in having that go-to if down the road that we can get what we need to get, the funding or whatnot, to potentially do what we need to do out of the airport, as far as that matter goes.
That's what I was wondering yesterday. How in the world do you lose F-35? You know?
Wow, it's the
Yeah.
Marines F-35.
The Marine side, yeah.
Did they find a debris field though? They found a debris field for that.
I seen that
Yeah,
late
they
last
found it.
night. I was reading,
Charleston.
the pilot ejected, and he was safe and all, and then they did cordon off of the debris field, so.
Well, that's good positive news, though.
As far as the F-35? or
No,
the-
about
Okay.
about
Well,
Tyndall.
I got confused there.
No, about Tyndall.
But yeah, I mean, that's
Give me
what I
a
was getting at. Our main, our goal there was to try to get more support for you to carry forward these discussions, on behalf of the county.
Well, I don't know if I've said this at a previous meeting, so I'll say it again today to make sure that I have. I don't know when it's gonna happen, but when I was able to sit down with Senator Simon last week, or week before last, I asked him specifically, one of the requests I had from him was for us to be able to set up a meeting with Senator Simon, Representative Shove, Mr. David Baer, which is the chair of Triumph, and myself. No staff in the room, so we can discuss how we can actually move forward with Triumph. That hadn't happened yet, but maybe it'll happen soon. But this will definitely help that discussion.
That was our goal.
Anything else from Mr. Morone? Oh, well, you're not off the hook yet.
Did it ever come to you?
No, not yet.
Well, maybe it will by commissioner comment.
Yeah.
You know how you make you remember? Call him and hang up, and remember as soon as you hang
Yeah.
up. No, I'm playing.
I'm just as guilty.
Attorney Schuler, go ahead.
All right. Commissioners, I would like to come back to item number 1, which is the draft VFD contract for Lanark St. James, and move on to item number 2. At the last board meeting, the board had asked me to consult with your labor attorney regarding Fonda Davis's request that the board consider hiring people who have felony convictions. I've spoken with Linda Carson, the labor attorney. There's actually no prohibition in your personnel rules about hiring felons. It's just that if they are a county employee and they get a felony, then there's termination provisions. Leonard does not recommend that you make any changes to your personnel rules, to simply that as applications come in, you take any convicted felons on a case-by-case basis. There's some examples I can give you, where someone with a conviction and a felony should not be hired as a county employee. For example, if they're convicted as a felony thief, they shouldn't be working in finance, handling money and things of that nature. But essentially the message is there's not an absolute prohibition to hiring felons. You just need to be careful and evaluate each applicant on a case-by-case basis. And if you have no further questions for me, or any questions for me, then I'll move on to item 3.
I do have a question.
Yes, sir.
In our current policy, so, and I'm fine with what he wrote in the email, I read the letter. But just looking at how we're gonna practically approach it. So he says that we should make sure that we maybe scrutinize the applications further or whatever. So we don't currently have a county policy where we do background checks on every person we employ, do we?
Do we do background check?
We
That's
do.
more of a, I think.
We do?
We do.
I think
Okay.
we do.
Yep.
Good, so that anything that should show up in the background check then?
Yep.
That's what I wanted to make sure of. I thought we did, but I wanted to confirm that, I wanted to make sure that we had the public discussion about it. You know what I mean? So people can understand that there is a method of practice that's already in place.
In drug-free workplace as well.
We
right?
are.
So there's drug
Yep.
screening.
Yep.
Okay.
Pre-hire
Alright.
drug screening.
Anybody else before he moves on? All right, please
All right,
proceed.
item number 3, this regards the safety project over in East Point. The board at some point in the past had taken action to direct staff not to process in the ordinary course the invoice for the $275,000 contract for dredging the additional east and west ends of the East Point Channel that were being paid for out of TDC funds as opposed to Corps of Engineering funds, and also your, I guess, Gulf Consortium or Triumph? I think it's Gulf Consortium funds. Consortium?
Consortium.
All right. So that invoice came in after the last board meeting. It's coming back up to you now under my report because the emergency contract, which authorized these services, and then some other issues regarding perceived and probable deficiencies in the dredging quality of the work in terms of the width and depth of the additional dredging has been brought to the board's attention, and y'all took some action to slow down the processing of the invoice. So it's now coming back up to you today under my report. The chairman and I have had a conversation. He has been talking with FEMA, and he's got some additional information to give to the board about why this is coming back up to you today. Instead of me telling you secondhand, because that's frankly hearsay, let the chairman tell you himself. So.
Okay. So Commissioners, I had a discussion with Miss Ashley Cronsrott from the Corps of Engineers, Mobile. She's the one that's been the project manager for East Point specifically the whole time. Now, she did have a maternity leave in between, but anyway, she's the project manager. She called me Friday to let us know that the Corps had done their final survey when they left before. They had went back and did an additional survey, and I did confirm that with some people in East Point. Mr. Gary Hunter specifically told me he saw them there doing it. At the time, they said they were going to be there, or that they were there. And immediately following Hurricane Idalia, they went and did another survey. And they do see inconsistencies with a lot of the channel. There's some places that are 3 or 4 foot deep. And the good news in the call was that she said that they didn't ask the county, they didn't figure we'd have a problem with it, that they'd already applied for FEMA emergency response funds to fix the channel, to get it like it's supposed to be. And they've not only been told by FEMA they would get the money, as of Friday when she called me, they already had the money in hand. So then we had a discussion. We talked for about 35 minutes on the phone as I was traveling down the interstate. She said that now they're trying to get a dredge that'll work. She claims that the dredge that's currently in Appalachia is too big, that it would, in a sense, if it were pushing mud into the beneficial use site that's been created in East Point, that it would actually blow the site apart because it has so much, it's a bigger dredge. I don't know, I can't speak to that, but we talked about some other options. But the biggest thing and the reason I thought it was good to have that conversation with her and had no idea this other conversation was going on, or that they had finally turned in their pay request. This company did the job we asked them to do. So yeah, I'm good with doing that and approving this request today. But I think the bigger thing is for the board knowing that the East Point channel is going to be fixed. It should be right when they get through, and it's not on our taxpayers or anything we've done. FEMA's doing it with money they're getting from the federal government that coulda, shoulda, woulda in the past, but we can't worry about that. We got to move forward, try to get it right before it's over with. And I think it's just it's kind of a weird set of circumstances that we couldn't have done. But anyway, yes, Attorney Schwartz.
Yeah. Just want to confirm one thing. When you and I were chatting, these FEMA funds that you were referring to, they're going to pay to re-dredge or fix, not just the East Point channel that was paid for using the consortium and Corps dollars. It's also going to include re-dredging the wings that we pay for with our TDC monies on the east and west, correct?
Yes, I specifically asked her, matter of fact, I called her back after we hung up the first time. I specifically asked Miss Ashley I said, it became apparent to the board and clear over the course of time that there was a permitted area, and then there was an area that was given the contract to be permitted, or to be dredged. I said, is this additional work you're coming back to do going to cover the entire permitted area? And she said yes. In fact, she said that apparently their calculations were so off the first time with the beneficial use site that once they get a dredge there, if they can dredge it deeper, they'll probably do that while they're there as well.
I have nothing further on the presentations.
Okay. I just wanted to give that background for the board to know why we're now coming back and asking us to approve paying this money. You know what I mean? But I think we're going to get what we paid for and what we deserve. what the people deserve, what we need. It's just went kind of a different path to get there.
Mr. Chairman, did she give you a timeline?
No, she said that they already had the money, and I asked her, I said, well, I don't know about you guys' procurement or your procedures. I said, but I can assure you, if there's anybody I know that has a dredge the size you are asking about, I will give you that information. I've since done that. So she acted like they were, as soon as they could find somebody to do it, that they would be doing it. It's not going to be a delayed thing. You know, as soon as they can get somebody under contract, they're going to be doing it.
Good, thank you.
Mr. Chairman, if you will, since I was the one that made the motion not to pay the contractor, with the information that you've told us now, I'll now make a motion to pay him, and let's move forward.
Would we include in that
One more thing.
information? I'm sorry.
Before we do that, I need you to add to your motion to allow the clerk's office to run a manual check.
I was going to
Oh,
fix that.
okay.
Actually, since they've scheduled the end of the month meeting on the 29th, we
can
can
do it then.
actually process it then.
Okay,
And
okay.
include in the motion that this is coming from TDC funds,
Yes.
so that it's clear for everyone in the
Yeah.
record. So those two things, if you would add to the motion, would be great.
Okay.
I had all that in the motion.
All right. So the motion's been amended, the motion to approve by Commissioner Amison.
I'll second, as long as, again, everything you said, that's all good, it's all good. I'm okay with with what you said, so I'll
Okay.
second.
All right, so we have a second by Commissioner Ward. Any more discussion before we vote?
Mr. Chairman, just real quick, I'll be honest, reading this last night, I'm like, oh, no, nope. But you assured me and reassured me that everything's
Yeah.
copacetic,
Yeah.
so,
Yeah.
all right, I just want to make that note.
Yes, and while we're discussing it, I did actually reach back out to Representative Dunn's office yesterday and I got Miss Nicole Smith on the phone is who I talked to, made sure she was aware. She said that they had still been having discussions in the background, but she was not aware that the Corps had applied for the FEMA emergency dollars or that they had the dollars. I said, well, I want you guys to know where we're at in this conversation since we involved you and you come down here and actually went out on a boat, so.
It looks like to me now that spoil site that they've got off the breakwater, that maybe now it will be like it's supposed to be.
It's supposed to be an island.
It's supposed to be a little island,
Yeah.
and so now maybe it will be a little island.
They're gonna
You
fix
know,
Allen's
um,
Island. That's what they're gonna do.
I'm not sure about East Point, but it'd be interesting to find out, but as our discussion with, is this Curtis, I think it's Huggins. Mr. Huggins. You know, those, 2 Mile Channel is actually originally designated to be a 10-foot deep dredge. We're only dredging like 6. And like he made the comment, you know, if you ever, in the future, don't get the permit or get the, get it, I guess, come up with the money or whatever, but, and go ahead and dredge it 10 foot, he said it would be years before we had to come back and look at this again, you know, given that there isn't any kind of natural disaster or whatnot.
But probably in the past, Otis, when they've dredged it, they probably haven't went in there and did the 10 foot like.
No, they haven't. That's what me and him was
That's the
talking
reason
about.
why you got it like that.
Yeah.
It'd be nice to have it.
Any more discussion before we vote? All in favor?
Aye.
Any opposed? That's unanimous.
And on a related issue concerning dredging, I did get the public records request response back from the Corps yesterday afternoon. I haven't had-
Yesterday?
Yesterday afternoon.
How timely?
They're about 7-8 days late, but go ahead.
I understand that they were late, but I did stay in touch with Attorney Joe Given, and he's been very responsive. I mean, I could tell you what his explanation to me has been, either on the record or off the record, if you'd like to know, but he's been very responsive.
Okay.
Does the board want me to proceed with reviewing the draft VFD contract or pass that on to the next meeting or some other future meeting? Because it doesn't look like you're going to be having a VFD in Lanark any sooner than January at this point.
I would just wait until it got closer
Yeah.
to time is what I would wait.
I will
And then
defer
that-
to the board's wishes.
I
Well, that
mean,
concludes my report.
Actually, I have a question for you.
Yes, sir.
Attorney Schuler, and it concerns our boards. We touched on this in your office the other day, and me and Michael's had discussion post our meeting, but, is there any insurance, set up for like our hospital board, our airport board, our P&Z, for instance, that protects them from, you know, potential lawsuits by them being advisory boards? You know, Michael, you want to help me out here? You're much more eloquent than I am with this.
You're talking about that. You're talking about D&O, directors and officers insurance, is how it's generally referred to. I know the hospital has a policy. I'm not aware of there being any general D&O policy for your other advisory boards, but.
Well, is P&Z covered? I mean, they're making.
Do we have D&O from the advisory board?
We have, you know, the FACT general liability policy that we carry, and for sovereign immunity, is there any sort of protection provided to them by actually, you know, acting
That's
as an
one
advisor?
issue I'm researching
Okay.
now for another reason. We don't yet have a definitive answer, whether or not advisory board members would be considered, you know, agents of Franklin County. I'm still researching that. And just because, I say we have D&O insurance at the hospital because that's what I've been told. I haven't personally verified it, but I've been told there's like a $2 million D&O insurance policy at the hospital.
Just my train of thought with this is that we're asking people to come in and volunteer and serve on these boards. I don't want to leave them vulnerable for any type of lawsuit or anything down the road. So that's the reason why I'm asking this.
That is an issue.
It could be because, I mean, we're gonna wind up, you know, all it takes is one ambulance chaser, excuse me, but, and then the next thing you know, nobody's gonna volunteer for these boards that we're asking for. So it's something we need to kind of look at and address potentially. And, that was just, that was it.
Mm-hmm. Yeah.
General
Mhm.
liability won't cover it, but
Yeah.
it would be D&O insurance.
Okay.
But the hospital board is covered, because I think, Michael, Mr. Morone, I'm getting these Michaels.
Too many Michaels to say Michael.
I know it. John, hey, John.
One of us will answer.
But anyway, you know, as per our last discussion, you wasn't really sure about the hospital.
No,
at the
I
time.
wasn't.
So that clarified that part of it, because I believe we had a potential hospital board member that was concerned about
And
that situation there. But anyway, that's
Mr.
just, so do we know that we have or we don't have?
I'll
Is-
find, Aaron's going to
Okay.
check with the FACT to see if there's any D&O insurance coverage available. Just, the general liability policy would not cover anything other than general liability. So.
And I'll ask David about Weems.
All right.
That may help with,
Ted, you feel better, Ted?
Mr. Chairman, I was gonna say that might encourage other people to volunteer. Because if they know that they could be held liable, then they may not want to put themselves at risk, and I get that. If we have some kind of protection, then maybe they will be more apt to serve.
That's like a commissioner, when you leave office, you're liable for a certain period of time on the decisions you make if ever challenged.
Now, I can tell you that I have looked at the issue that you just raised, Commissioner Sanders, and commissioners have immunity. I mean, you're clearly covered by sovereign immunity. There are certain exceptions to that protection, but they're rare and few and far in between, where you have to essentially act with, you know, intentional bad faith. But for the most part, you have absolute immunity.
Don't tell me that.
Do we have an update, Attorney Schuler, to any of the different things that we have out, as far as like the property in East Point or the property at the airport or any of those?
I'm surprised the surveyor and the appraiser have not filed stalking charges against me, but yes, I'm following up with them diligently, you know, depending on the circumstances. For example, the appraisal on Gulf State Bank was ordered just a couple of weeks ago. I've only followed up with them once on that. The two appraisals at the airport have been outstanding for over a year, and that's becoming a real point of frustration for me. Now, I understand airports are unique animals, you know, they're like unicorns, but, you know, at some point, you gotta find a unicorn. Surveyors, the 3-acre survey, you know, I spoke with Thurman last week. He tells me it's completed. He and I had a phone conversation because I wanted, just as a matter of policy, an elevation certificate, because I don't know what the board's future plans are. But he doesn't want to give the elevation certificate because he says it's outside of the flood zone. So I said, let's compromise. put that statement on your survey, so he's working certified
Outside the
survey.
flood zone, we 12 months away from having fought with FEMA saying it was all in a flood zone.
I'm just telling you what, I'm not a surveyor, I'm telling you what the surveyor told me.
Okay.
But he says it's actually in an X zone, it's not a shaded X, it's not a VE zone, it's not a V zone, he says it's an X zone. I said, well, I still want some documentation, so he's going to document the elevation in some fashion on the survey. He told me that he would get out there, I believe it's this week, and survey the Gulf State Bank building property. And usually, with Mr. Thurman, when he's done field work, he gets you the drawing,
Right.
pretty short order.
Okay.
What I'm expecting, frankly, is that the appraisals are going to probably be the last thing to finish the cross the finish line, sorry.
Okay. One other thing I want to bring up under your report, because we did under your report to begin with. I think, unless the board tells me different today, we've had the discussion, TDC's weighed in on it. I think we need to put on the agenda about renaming our sports complexes, or what do we have to do to allow us to be able to take them to the next step, where the TDC can actually start doing sports tourism in this county. And it's gonna entail all three of the parks. But I think we need to put it on the agenda so we can make that legislative finding by a vote of this board and move on with that issue. Unless
Put
the rest of
that
the
on
commission's
my report
opposed
for
to
the
it.
next meeting, or wait for further instructions?
I'm good with the next meeting. We either are or we aren't, you know what I mean?
Going back to the appraisal, that's a commercial appraisal on the building, I'm assuming. What company did we go with? Did we finally?
For the Gulf State Bank building, there are two, and I can't think of the name of the second one. The first one is the appraisal group in St. Joe. I frankly can't think of their name right now either, but they were ordered the same, both appraisals were ordered the same day that the board approved and signed the contract. So if I remember from the second appraisal group, they were expecting to have something to me by the end of September, because they said it'd be about 4 weeks, and I did not get a time estimate from the first company. That'd be the one over in, what, the appraisal group in North Florida, I think it's called, in St. Joe.
But the second one, they're from Wakulla? Because it's my experience, I don't believe we have one
I
local.
think he's actually from Bay County.
Okay.
I know he and I have been texting, so let me see if I can find that for you.
That's fine, I mean, I was just
But I don't
being
wanna hold-
curious.
I can just send a follow-up email to the board.
That would be great. Anything else? Commissioners, for Attorney Schuler?
I got commissioner's comment.
Okay. Well, we'll move on to commissioner comments, please.
Okay. I told you I was gonna have something to say about the boat ramps and stuff when it got to commissioner's comments. You've got 3 boat ramps in the Alligator Point area, and you got Sun and Sand, Leonard's Landing, and S Curve, and all of them have been deemed as not feasible to do any kind of a boat ramp through any of the state programs. What I would like to do is see if we can get our legislative delegation or our lobbyists, because we've still got the lobbyists, that can go in there and see what we can do to pull something. We're gonna have to do something, because we've got the clamming and the oyster aquacultures out there. They can't pull their baskets or anything out to work them. So I'm telling you, we're gonna have to do something. So that's the reason why I thought maybe that could be one of the issues that you bring before the legislative delegations, that we're having trouble with the state coming in there and with the limits that they put on them, and try to do something that they could maybe do an appropriation or talk to the agencies for us or something. All the people that were at the agencies when I was first on board, they're gone. So you don't know nobody to talk to. The agencies are so disengaged with the counties, it's pitiful sometimes. So that's one of my things. I just want to bring somewhere in between Leonard's Landing, S Curve, you know, and Sun and Sand, somewhere in there, we ought to be able to have some kind of a boat ramp that can be used for the, boating and for commercial fishing activity.
That's right.
A good argument with that is the fact that those guys are leasing those leases from the state.
Yes, they are.
The state is making money off of the people that are farming clams and oysters down there. That should, it should fall in their wheelhouse to,
Yeah.
provide them a means of getting to and from the leases that they are leasing from the state.
Well, every time you go to do, and I'm gonna be quite honest and frank, 'cause truth don't never hurt you. And that is, the Leonard's Landing is, underneath that sand, that shifting sand, there's asphalt up underneath there. But the DEP won't let you try to clear it out. Long time ago, we could take something and get it out, and the people could use it. Now, if you try to do it, DEP won't put you up underneath the jail. But, and they still do. But I'm being truthful about it. But they're not listening to what their concerns are, the clammers and the oystermen. They're not listening, they're not even worried. And not only that, we're a county that has 70 miles of coastline, and on one part of our county, we can't even find a place or even be allowed to put a boat ramp in that's sufficient enough to take care of the boat and the fishermen and all. That's ridiculous.
That the state's making money off of.
That the state's making money off of, that's right. But anyway, that's one of my one concern. I got others, but hey, we'll take it in due time.
Any other commissioner comments today? Meeting adjourned.